खींच दिया मैंने।
Dr. Gunjan. For Koda Makanpur Obs and Gynae Society to be associated with this anti-anemia drive. I'm thankful to our President, Dr. Rishikesh Pai, who gave us, and we are such a young society. Thank you, sir, for that. Of course, we know anemia is rampant and widespread in our country. And the incidence, as per the latest survey, has gone up to 59%, which is even before more than the 216 survey. So for anti-anemia, the government of India started a program in 2018, and we all are trying to work against it. And so we start this program with Nana Anemia.
Nana
Anemia. Nana Anemia. So I will request Dr. Somna Goyal, our president of FOXY, to please kindly come and give a welcome address.
Namaskar. Good evening, everyone. It is my proud privilege to extend my warm greetings and welcome you all, our esteemed guests, to this special program on Anemia Mukt Bharat. I welcome my chief guests, Honorable General V.K. Singh, Minister of State, Ministry of Road Transport and Highways, Member of Parliament, Ghaziabad. We welcome you, sir. Sir has some emergency protocol to follow, so he's not there. But we will play his video message for our encouragement later. We have Shri Santosh Yadav ji, Eminent Additional Secretary, Ministry of School, Education and Literacy Department. Sir, आपका स्वागत है. Our guests of honor, the great visionary, our own Dr. Upasana ma'am, Director Yashoda Super Speciality Hospital, Ghaziabad, the very distinguished Dr. Archana Verma ma'am, past Vice President, North Zone FOXY, the ever supportive, respected Dr. Bhavtosh Shankdar sir, CMO Ghaziabad. We welcome you all. And our distinguished dignitaries, the illustrious Dr. R.S. Sharma, sir, retired head, senior Deputy Director, General Division of Reproductive Biology, Maternal and Child Health, ICMR. The outstanding Mr. Binod Kumar, Chief Controller of Accounts. He's not there. And our special guest, the very inspiring Mrs. Nipra Majumdar, founder of NGO Samriddhi School, the hugely admired woman of substance. I will request Nipra ji, please stand up so that we all acknowledge you. Thank you for coming. The hugely admired woman of substance, Mrs. Nandini, founder of NGO Khushi Foundation. And all our FOXY stalwarts.
We'll request Dr. Pai, our president, to please come to the stage. Our vice president, North Zone, Dr. Yashodhara Pradeep.
Ma'am, please. Dr. Alka Pandey, ma'am.
Alka Pandey, ma'am, please come. And of course, our own and dear Dr. Archana Verma, who has already come. Thank you, ma'am, for coming to the stage. So we will.
Our media friends, समाज का दूसरा स्तंभ, हम आपका स्वागत करते हैं. It has been an incredible journey of 16 years of academics and togetherness and learning from a forum to CHEMOC Society, and then affiliation to FOXY. It would not have been possible without our pillars of strength, our mentors, our guiding force, our patron, Padma Shri Dr. Usha Sharma ma'am. Ma'am, we are missing you on this very special occasion. And our multi-talented, multi-dimensional, exemplary leader, respected Foxy President, Dr. Rishikesh Pai, sir. A big applause for Sir. तालियों की गड़गड़ाहट होती रहे. Sir, we are obliged and thankful to you for bestowing us with this responsibility and to be part of this special yatra, Swasthe Nari Jan Andolan Yatra, Anti-Anemia Right. Thank you, sir, once again for showering your blessings upon our society. The team of CHEMOX is excited and overwhelmed with your august presence. With a warm welcome, now I hand over to Dr. Gunjan Gupta and Dr. Garima Tyagi for further inauguration and felicitation program. Thank you.
Dr. Somna, so like any event, Saraswati Maa ki Vandana se shuru hoti hai. So let's start with the lamp lighting. I will request all the dignitaries to please come and do the lamp lighting, please. Dr. Somna, please come.
Madam and the whole team for Saraswati Vandana presentation.
thank you for the beautiful presentation. Dr. Manju, Dr. Neera, and Dr. Meeta. It was genuinely very nice. And now, since our chief guest, Dr. Santosh Yadav, who is additional secretary currently, and he has given us the time to come, I would like to invite you. And of course, he is a very, very integral part of Ghaziabad, who has been with us. Dr. Garima wants to say a few lines about him.
मैं आपको ये बताना चाहूँगी कि एनीमिया ड्राइव तो अब पैन इंडिया शुरू हुई है, लेकिन सर हमारे 2007 में डीएम रहे, फॉलोड बाय 2014-2018 के बीच में वीसी रहे हमारे और चेयरमैन भी रहे जीडीए के। और ये बात शायद बहुत लोगों को नहीं पता होगी, लेकिन जो लोग उनके साथ एसोसिएटेड हैं उनको पता होगी कि ये साइट के ऊपर जो इंफ्रास्ट्रक्चर साइट आज जो आप गाजियाबाद देख रहे हैं, एलिवेटेड रोड्स देख रही हैं, ये इन्हीं का एक विजन था और आज वो परिपूर्ण होता है और हमारी गाजियाबाद डिस्ट्रिक्ट को कमिश्नरी डिक्लेयर किया जाता है, विच इज़ अ बिग थिंग। प्लस उस इंफ्रास्ट्रक्चर की साइट पे जितने फीमेल लेबर्स और उनके बच्चे थे, सर 100 to 8 की उन बच्चों का और उन महिलाओं का अनीमिया प्रोफाइल चेक किया जाए रेगुलर बेसिस के लिए। और सर ने ऐसे बहुत सारे प्राइवेट हॉस्पिटल्स के साथ उन साइट्स को अटैच किया और उन बच्चों को हेमेटोमैनिक्स भी दिलवाए, उन महिलाओं को भी दिलवाए। सो ये ड्राइव जिसमें आज हम आपको सर एज ए चीफ गेस्ट बुला रहे हैं, थैंक यू सो मच, लेकिन सर के दिलो दिमाग में और उनके विजन में बहुत पहले से थी। सो आई वुड लाइक गुंजन टू कॉल अपॉन सर।
Thank you. Sir, you please. Thank you.
चेयरमैन फॉक्सी साहब, सीएमओ साहब, डॉक्टर उपासना अरोड़ा, मंच पर उपस्थित डॉक्टर साहबान, सारे डॉक्टर साहबान, बड़ी एक जो परफॉर्मेंस अभी देखी से दिल से डॉक्टर साहबान दिल से परफॉर्मेंस, और ये प्रोग्राम भी एनीमिया प्रोग्राम भी आप उसी तरह से दिल से कर रहे हैं। जर्नी मैं यहाँ क्यों बेसिकली आया हूँ, मेरा यहाँ आने का एक अपना भी स्वार्थ है। स्वार्थ ये है कि मैं भारत सरकार में स्कूल एजुकेशन यानी क्लास 1 to 12 स्कूल एजुकेशन पूरी कंट्री की देखता हूँ। हम लोगों ने नेशनल एजुकेशन पॉलिसी 2020 लागू कर दी है और उसके गोल्स हैं, नेशनल एजुकेशन 2020 पॉलिसी के गोल्स हैं। गोल्स क्या है? एक्चुअली क्या है कि अब हर चीज़ हम लोगों ने देखा कि जो पीसा होता है, पीसा क्या होता है, दुनिया के 80 कंट्रीज़ के बच्चे compete करते हैं, एक इंटरनेशनल एग्ज़ाम होता है, उससे कंट्रीज़ की रैंकिंग होती है बच्चों की मेंटल डेवलपमेंट की, पढ़ाई की। तो हम 80 में से 75 में आते हैं। जबकि आप ये देखिए कि क्या होता है कि यहाँ पर बेस्ट ब्रेन भी यही है, सारे सिलिकॉन वाले दुनिया के सब चीज़ यहीं के लड़के, आईआईटी के लड़के, आईएम के लड़के, या आपके एम्स के लोग, या डॉक्टर साहबान, सब दुनिया के सब कुछ यही करते रहते हैं। लेकिन वो है क्या, क्यों वो हम लोगों ने उसको एनालाइज किया तो क्यों पिछड़ रहा है, हमारा मामला क्यों पिछड़ रहा है? हमारे बच्चे का होलिस्टिक डेवलपमेंट नहीं है। बच्चे तो हमारे पास सिस्टम में लगभग 26 करोड़ है। अब होलिस्टिक डेवलपमेंट क्यों नहीं है? क्योंकि अगर मैं सिर्फ और सिर्फ पढ़ाई पे ही ध्यान दे दूं बच्चे की, मैं आगे भाई पिछले 1947 से 2022 आ गया, यही तो कर रहे हैं, पढ़ाई 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 पे ध्यान दे रहे हैं, बट उसके जो डिजायरेबल रिजल्ट कहाँ मिल पा रहे हैं हमें? क्यों नहीं मिल पा रहे? बहुत सारे कंपोनेंट्स जो कि पर्सनालिटी को होलिस्टिक बनाते हैं, जो कि ब्रेन को होलिस्टिकली डेवलप करते हैं, वो ये है, अगर उसमें एनीमिया की कमी है बच्चे में, तो कितना भी आप कर ले, एक लिमिट से आगे थोड़ी ना बढ़ पाएगा वो। तो मैं यहाँ इसलिए आया हूँ डॉक्टर साहब कि जो हम एजुकेशन में वो करते हैं, एक कंपोनेंट है हमारे कस्तूरबा गांधी विद्यालय है। लगभग कंट्री में 6000 विद्यालय हैं, टोटली फॉर गर्ल्स हैं। गर्ल्स उसमें 12 साल से 18 साल की बच्चियां हैं, लगभग 6 लाख बच्चियां हैं। मेरा अनुरोध ये है कि अगर किसी तरह से कोई एक आपकी एक तरीका निकले, आई मीन जो हेल्थ मिनिस्ट्री गवर्नमेंट ऑफ इंडिया, उससे हम लोग, क्योंकि हम लोग पूरी तरह टाई अप कर लेंगे, दे विल कम ऑन बोर्ड, लेकिन जो नीचे की निटी ग्रिटी कैसे आगे हो, ताकि ये जो इस कोहोर्ट में जो 6000 स्कूलों में 6 लाख या 7 लाख बच्चियां हैं, इनका जो एनीमिया का अगर चेकिंग हो जाए और उसके साथ अगर करस्पॉन्डिंग कमी मिलती है तो उसके सप्लीमेंट्स उनको मिल जाए। अगर कोई इस तरह की चीज़ निकल आए तो मैं तो आज इस मकसद से आया हूँ। मैं तो सच बताइए, मुझे बहुत काम था, लेकिन मैंने इसमें एक अपॉर्चुनिटी देखी। मैंने कहा मेरी अगर बात चल जाएगी तो क्या हो जाएगा कि कम से कम इन 6000 स्कूलों में मैं एक होलिस्टिक डेवलपमेंट उसको कर पाऊंगा। तो मैं इसके लिए आप जिससे भी कह देंगे डॉक्टर साहब, आपकी टीम में से, मैं अपने यहाँ से एजुकेशन मंत्रालय से एक टीम डिप्यूट कर दूंगा। पहले डाउन द लाइन आप लोगों के साथ काम करेगी, फिर उसका, क्योंकि ऑलरेडी हमारा एक प्रोग्राम चल रहा है मिनिस्ट्री ऑफ हेल्थ डिपार्टमेंट गवर्नमेंट ऑफ इंडिया से, दैट इज स्कूल हेल्थ। स्कूल हेल्थ में कंट्री के 765 में से 191 डिस्ट्रिक्ट्स में हम और हेल्थ डिपार्टमेंट साथ साथ काम कर रहे हैं बच्चों के लिए। बट specifically because this is anemia for women, I could read it, so I would be much interested in these 6,000 schools and 6 lakh girls. They are pan India, सिटी में भी हैं, रूरल में भी हैं, पूरी कंट्री में भी हैं। तो आप अगर जिस तरह से आप बताएंगे तो we will proceed। तो क्योंकि क्या होगा, if I am able to do this program in these 6,000 स्कूल्स, तो मैं इसको स्केल अप करा दूंगा, क्योंकि इस समय हमारे पास स्कूल हैं लगभग 15 लाख। तो उन 15 लाख, तो अगर इस 6000 स्कूलों से पायलट करके फिर इसको फेज वेज में आगे ले जाएंगे इसको। तो अगर कोई इसकी ऐसी वो बने तो मैं अब एक चीज़ 2 मिनट, क्योंकि नेशनल एजुकेशन पॉलिसी के बारे में 2 सेकंड बता दूं। पॉलिसी अब करेगी क्या, हम लोग जो है ना, अभी होता क्या है कि अगर सपोज करिए आपका बच्चा क्लास 4th में है, मैं ये आपसे पूछ लूं कि आप 4th में आपके बच्चे को क्या आना चाहिए, तो आप ये समझें कि बच्चा एकदम राइट ट्रैक पे है, आगे चल के बहुत अच्छा निकल जाएगा। तो पता ही नहीं है, पता नहीं है, क्योंकि हम लोगों ने क्या किया, अभी तक ये बनाया ही नहीं था। होता क्या है कि साल के अंत में रिजल्ट आया, रिजल्ट में पास हो गया या फेल हो गया, उसी से हमने आका उसको। तो हमने उसके लर्निंग आउटकम बना दिए। लर्निंग आउटकम क्या है कि उस बच्चे को अगर क्लास 3 में है, एक देसी भाषा में क्या चीज़ माँ बाप को भी पता चल जाए, टीचर को भी पता चल जाए कि क्या आना। जैसे मान लो कक्षा 3 में है, क्लास 3 में है, तो उसको जो है ना 60 वर्ड्स पर मिनट बिना रुके 1 मिनट में 60 वर्ड अगर पढ़ लेता है और उसको समझ लेता है, तो आप समझ लीजिए कि राइट ट्रैक पे है वो। 999 यानी कि 10,000 से नीचे तक के अगर अंकों को लिख लेता है या उससे मल्टीप्लिकेशन कैरी ओवर कर लेता है, ही इज ऑन राइट ट्रैक। तो उसके लिए आपको इंतजार नहीं करना कि पूरे साल के एंड में एग्जाम हो तो। और इसको हम लोग यानी कि हर स्टेज, यानी प्री स्कूल मतलब क्लास 1 से पहले जो बच्चा प्री स्कूल में जाता है, केजी में जाता है, उसमें बच्चे को क्या आना चाहिए, क्लास 1 में क्या आना चाहिए, क्लास 2 में क्या आना चाहिए, क्लास 3 में, ये इसको हम लोगों ने अगर ये बना दिया, ये साइंटिफिकली तय कर दिया है, बना लिया है कि ये अगर आएगा तो बच्चे का प्रोग्रेशन राइट ट्रैक पर है, वो बच्चा राइट उसमें निकलेगा। प्लस मोटी मोटी का चीज़ और बता दें सबके इंटरेस्ट की। दूसरा क्या है, अब हम लोग पढ़ाई को पढ़ाई से नहीं नापेंगे। यू नो, आई कुड सी डॉक्टर साहब कितना अच्छा परफॉर्मेंस दे रही थी, ब्यूटीफुल परफॉर्मेंस ही वाज डूइंग। अगर ये पैशन है इसका हर आदमी, एक तरफ हम कहते अभी तक चले आ रहे हैं कि हर बच्चा, हर आदमी यूनिक है। अब यूनिक तो है, आप कह दे रहे हो, लेकिन उसकी जो है बच्चे की परफॉर्मेंस आप नापते हो पढ़ाई से यार, कि साल के अंत में अगर वो 100 में से 60 ले आता है तो फर्स्ट डिवीजन है, और 133 से नीचे ले आया तो फेल है। जबकि बच्चे में तो टैलेंट ये वाला भी है। तो अगर किसी भी तरह का टैलेंट होगा उसमें, अगर वो अच्छा पियानो बजाता है ना, तो पियानो बजाने पे भी उसकी जो हम कैपेसिटी को मेजर, उसके आउटकम से डिफाइन कर देंगे, उसको उतना ही नंबर दे देंगे। यानी कि हर जो भी विधा में जिसमें एक्सेल कर रहा है बच्चा, उसको उसकी पढ़ाई में जोड़ दिया जाएगा। और इसे कहेंगे क्रेडिट, यानी कि उस बच्चे को उसको उस चीज़ का क्रेडिट मिल जाएगा। और उसी से अच्छा दूसरा ये कि आप सब्जेक्ट का बैरियर ख़त्म कर देंगे। कैसे ख़त्म, आप देख, मतलब अभी कहते हैं कि होगा कैसे, ऐसा है मैंने सिविल इंजीनियरिंग कर रखी है साहब, IIT से सिविल इंजीनियरिंग कर रखी है और उसके बाद एडमिनिस्ट्रेशन चला रहा हूँ मैं। अब आप कहें कहाँ सिविल इंजीनियरिंग कहाँ एडमिनिस्ट्रेशन, होता क्या है, अगर आप अपने यहाँ भी किसी टेक्नीशियन या किसी को लेते हैं तो क्या होता है, आप 1 2 3 महीने ट्रेन करते हैं, उसके बाद वो मास्टर बन जाता है। वो एजुकेशन तो खाली एक आपको एक कॉन्फिडेंस और एक लेवल देती है। तो हम लोग हमारा ये मानना ये है कि जो हमने सब्जेक्ट बनाए हैं ये सब्जेक्ट खत्म कर देंगे हम लोग। कोई भी किसी के साथ कोई कॉम्बिनेशन ले लेगा, यानी फिजिक्स के साथ म्यूजिक ले लेगा, आर्ट के साथ वोकेशन ले लेगा, जो मन में आए सब्जेक्ट ले यार, क्योंकि एट द एंड ऑफ डे तो मुझे तो उसकी जो है ना होराइजन ब्रॉडन करना है। उसके बाद जिस भी जॉब पे जाएगा तो अगर उसका एक IQ हमने सेट कर दिया तो जिस भी जॉब जाएगा 6 महीने के अंदर सेट हो जाएगा वहाँ पर। आई एम सॉरी मुझे निकलना ही नहीं, तो मैं इसके बारे में बहुत मैं लेट हो रहा हूँ, मैं बहुत उसको बताता। मेरी फिर एक बार डॉक्टर साहबान आपसे गुजारिश है कि जो मैंने ये कस्तूरबा गांधी विद्यालय के लिए आपसे अनुरोध किया है, अगर इस पर तवज्जो आप दे देंगे तो मैं समझूंगा कि मेरा यहाँ आना बहुत सार्थक हुआ। बहुत बहुत धन्यवाद, थैंक यू।
सर हम चाहेंगे कि आपका एक फेलिसिटेशन कर सकें हमारी केमॉक्स की प्रेसिडेंट डॉक्टर सोमना गोयल, प्लीज आइए मैम। With a token of sir fresh flowers and due to winters a fresh stall. Thank you so much sir for sparing time for us. Thank you so much. Felicitation now, and I request Dr. Gunjan to felicitate our Foxy President Dr. Pai with a bouquet of flowers and a stall. Dr. Deepthi, please come with the bouquet. Dr. Deepthi, आइए। She'll come from this side. I'll give her a hand. Please. अरे सर, मैं तो हुई।
Come. Dr. Pooja, please accompany with the bouquet. Next, I will request Dr. Shalini to come with Dr. Anika. Yeah, I will request Dr. Shalini. Dr. Garima was a joint secretary and Dr. Shalini is a clinical secretary. Dr. Shalini, please felicitate Dr. Alka Pandey, our Vice President, North Zone. And Dr. Anika is a very active member. Please present the bouquet. I will request Dr. Manju Barak to please felicitate Dr. Archana Verma and Dr. Nupur, please. Dr. Archana Verma is past Vice President, North Zone. Of course, she is a very dear person to us. We are always there, ready with her. She'll always be there to help and welcome us. So please, Dr. Manju, please felicitate her. Next, I will request Dr. Deepa to be ready. with Dr. Vandana Jain. Our dear Upasana ma'am, Medical Director, Yashoda Group of Hospitals. And of course, the way she has supported us is commendable. Today morning we had a camp at the hospital. Ma'am ने हमें हर तरीके से help किए as far as patient registrations and everything else is concerned. It was just a pleasure. Dr. Somna, please be there. I will request Dr. Raka to be ready.
Raka Singh ma'am,
Dr. Raka Singh ma'am
and Richa Singh.
and Richa Singhal to please come. हाँ CMO सर का है मैं उन्हीं को बुला रही थी. Dr. Raka Singh ma'am, please आप Dr. R.S. Sharma को felicitate कर दीजिए. Dr. R.S. Sharma has been closely associated with maternal health and ICM. He's been Deputy Director ICMR and ART. Sir के साथ बहुत पहले से हम लोग का मिलना जुलना रहता है. And he gives such excellent advices and he has worked a lot at the time of COVID. He has given advisory to the government as well. Next, I will request Dr. Smita Jain to please felicitate Dr. Ashish and Dr. Seema Prakash, please accompany and hand over the bouquet to Dr. Ashish. सीमा मैम आ जाइए. हाँ डॉक्टर हाँ अच्छा अच्छा okay yeah. I will request Dr. Monica to be ready for the felicitation of Bhavtosh sir. And Dr. Anita, please accompany with the bouquet. Dr. Anita Singh. अच्छा ठीक है. हाँ सर सर आइए प्लीज. And I will request Dr. Vandana Jain to be ready for felicitation of Dr. Meenakshi Shah. Dr. Vandana Jain, please felicitate our young and dynamic Priyankur, and Dr. Meenakshi Sharma, please hand over the bouquet to Priyankur. Of course, our very senior professor, my teacher, Dr. J.B. Sharma is there. Sir, I would request to please come on the stage, and I will request Dr. Mridula Gupta to please come and felicitate Dr. J.B. Sharma, and Garma to please accompany with the bouquet. Dr. J.B. has been my teacher and professor right from the Maulana Azad days, and I've learned a lot under his training.
करता धरता हैं, आई वुड लाइक डॉक्टर सोमना, प्लीज़ उनको बुके से उनको वेलकम करें प्लीज़। निप्रा जी प्लीज़ आइए, नंदनी जी प्लीज़ आइए। मैडम ये एक ऐसी एनजीओ है जो बहुत ही लोअर क्लास बच्चों को खाना भी खिलाती हैं, जिसे मिड डे मील बोलते हैं, और पढ़ाने की जिम्मेदारी और उनकी सारी चीज़ों में करती है। और हमारी केमॉग्स इस समृद्धि और खुशी फाउंडेशन को हर तरीके से मॉनिटरी या स्टेशनरी या बुक्स या कपड़े जो जो जिस तरह का सुविधा दे सकते हैं वो मैडम हम लोग कंट्रीब्यूट करते हैं। So thank you both of you to come today on this evening. हमारे बीच में और भी बहुत सारे डिग्निटरीज हैं। डॉक्टर टी.एस. पाल, आपका बहुत बहुत वेलकम। डॉक्टर गुज्जर, मीडिया वाले।
So now I will request our media who has come to support us to kindly come towards the stage. They have come from Aaj Tak, from Times of India, from Dainik Jagran, and all fields. I will request these people to kindly come to the stage so that we can felicitate. I will request Dr. Pai, our president, to please felicitate our media. Mr. Haseen, Mr. Anand, Mr. Abhijit, please come towards the stage. वो भी ला दो। हाँ, एक सेकंड, सॉरी, एक ड्रॉप ऑफ ब्लड।
Showing a drop of blood. That is the best part of this moment. Thank you so much.
और कोई है? मृदुल, मृदुल और कोई? एक और। कुछ भी तो ये तो नहीं है, कुछ भी नहीं। एक है ना वहाँ कोने में? Momento. Request Dr. Pai to please come and say a few words of encouragement for us. Thank you, sir.
Respected Mr. Bhautosh Sangdar, CMO Ghaziabad, Dr. Rajesh Sharma, our great friend and from ICMR and now in the Shada University, Madam Yashoda, Madam Upasna Yashoda Hospital, the owner of Yashoda, and who has been really kind enough and who is a dynamic leader in our community. Dr. Archana Verma, our Vice President previously, and now also very active. We are expecting a lot from her. And our two Vice Presidents presently, Dr. Yashodhara Pradeep and Dr. Alka Pandey. She is from representing North India and she is representing East India. And then we have a lot of dignitaries in the audience. Dr. J.V. Sharma, our professor, is there. Dr. Ashish Mukhopadhyay has come from Calcutta. He is the scientific committee chairman of the AICOG Calcutta now. We are expecting 10,000-12,000 people, and Dr. Priyankur Roy is there in the audience, and Dr. Miss Ojaswini is there. And then Gunjan and a lot of people, I must take their names, but Garima, Gunjan, all of them are there. Our president is there. So basically, we started this yatra yesterday, in Rishikesh, because I always wanted to do something different. I feel that we have 5 aspects of FOXY. One is academics, which we all do all the time. Then we have the research, which we also are doing, going to do a lot of research work this year. But research should be multicentric. So a lot of people are participating in the research. And then we have the fellowship activities, very important. Dancing, meeting people. We have got 3-4 things this year. Talent program is there. And we have got Mr. and Mrs. Foxy program, which is starting now. You can all participate. So all smart, beautiful ladies in Khora, Makanpur and Ghaziabad area. I'm sure one of you will win this competition. And then we have got the CSR, which is very important. The social responsibility is very important for us. And this is a part of the CSR program. So when I coined my campaign, I called it, so my dad was director of family planning, and 1971 he coined the slogan Chota Parivar, Sukhi Parivar. So he got Padma Shri in 1971 for family planning work. And so I thought that I should coin something similar. I always hero worship my father because he was a freedom fighter. He was in jail for 4 years, 1942 to 46. He was jailed by the British for freedom. So he was a public health professor. And so I coined the word, I have coined the slogans, is Swastha Nari, Sukhi Nari. So if you are a healthy person, you are a happy person. So healthy woman is a happy woman. And जो मेरा CSR slogan है, is called Badlav. Badlav means change. Change, and it is defined by 3 words. That is ekikaran, that is integration. Then second word is equality. Equity बोलते हैं उसको आजकल. So that is samanta. And third is technology. ये दोनों का by using technology you can bring about a change in the way we practice medicine. So ये जो बदलाव में अलग-अलग पहलू है. अभी if you see outside now, I got this van and I integrated everything in the last 5-6 but let's say about 10-15 days we have integrated. I brought in a cartoon film which is about 10-12 minutes, so you can play it in your, will modify it and refine it, and I will distribute it to all of you. So when your patients are sitting in your consulting, they can see this film and it will have wording. So, because sound will disturb the patients. So they can watch, because unless you give them information, see, information is the most important thing that brings about change in society. So when I took over as president, I said, what is it that I should do? After I finished my 1 year as presidency, when I look back after 20 years and I say, अच्छा मैंने क्या किया Foxy के लिए? So most important thing is information. If you can tell the patient these things are available, then only they'll come to you and demand for it. Now you can't keep on telling someone to do hemoglobin. You have to tell them, they should come to know that there is something called hemoglobin test and that causes anemia, and they should come and ask you for that test. So information. So if I was the, let's say if I was the Prime Minister, let's say Health Minister of this country, I would have spent 10,000 crores on information. Every day I would hammer all the 400 channels, I will hammer everyone with information about ethics. Health is a part of ethics. You have to tell them, don't spit on the road, don't steal. So these are morals and ethics. If you bombard them, or if they take up a mobile phone and if they answer a call, but before that you have to listen to a message, they will take the information. Because majority of our people, they stay in villages and juggis where there is no samskar. They don't have a mother to tell them. They don't have anyone to take care of them. How will they know how to behave in society? They don't know only what to do. So this is what I felt. So the part of the Badlav campaign was the national anemia, what is called a Nari Swastha Janandolan Yatra. So I have planned this yatra, which is starting from Rishikesh, and it will go through 20 states. So the second, yesterday we went to the Ganga Ji on the banks, and Karishma Kapoor ji ne isko launch kiya, and then in the evening we went to Dehradun where our chief minister, dynamic chief minister Dhami ji was there. He was sitting with me and we launched this program. He's a dynamic chief minister. He feels that is very important. And actually I was going to do this yatra. So this yatra is crossing Uttar Pradesh, Uttarakhand, Uttar Pradesh, Bihar, Jharkhand and West Bengal. And I was then going to do it in 4 other parts, in 4 other regions of the country. But yesterday when the CM said, Dhami ji said, नहीं, हमारे इधर तो एनीमिया ज़्यादा है, डॉक्टर साहब आप इधर आके कुछ करो. Then I said, yeah, I should really, after I finish this yatra, I need to analyze. Like today, our senior person, our education secretary said that he would like to do things. So what I felt that I need to restructure my thought process. Instead of doing it in 4 states, I may still do it, but I'll concentrate on these 5 states only. So after I finish this yatra, which is till 5th of January, I will think what I should do next so that we can concentrate on these 5 states and elevate and escalate it. But anemia is just one part of it. I want to bind it. So when I touch any patient, everything about medicine she should know in that 12 minutes. And if you see this cartoon, which is, just when you have got the cartoon, later on we'll play it for them. It's in 12 minutes, everything I've told them. And I want you all to record it. So we have got recording also of our colleagues. Again, 2-minute recording. Within 12 recordings, we have told them everything. It's like you're conversing with a patient. Beta, कैंसर सर्विक्स का ऐसा होता है, ऐसा होता है, ऐसा होता है, ये टेस्ट है, पैस्मियर है, एचपीवी टेस्ट है, हर 2 बरस में करना है, यदि कुछ प्रॉब्लम हो गया तो जल्दी ट्रीटमेंट लेना है, बस. You don't need to tell them more, but they need to know that there are the 3 main cancers of cervix, breast and bowel together. You can't have a surgeons association telling them about breast cancer, gynec association telling them about cervical cancer. That's wrong. We are disseminating, we are spending our energy. We need to do it in one shot. At the same time, tell them about everything. So this is my concept of integration. And the second concept is of equality. So there are 2 groups of people in our country. 1 billion are poor. They have nothing with them. And that 300 million are well off. So it's our job, it's our responsibility to do free treatment for that 1 billion people. We have to do it. Whatever happens, we have to do it. It is not any more charity, it is a responsibility. So that's the concept of, but you have to do it equally. You can't say that, okay, that person is poor, so I'll just give him 5 minutes. I do it myself also. In my clinic, if there is a patient who comes, sada patient, I'll tell him, acha, kya hai? 5 minutes, I will then tell my assistant to see the patient. While there is some fancy patient who comes, I'll haath pakad ke uska, haan madam, kaisa hai? So I also discriminate. It is in my blood. I subconsciously discriminate, and that is what we should try to. I'm not saying don't do it. It's very difficult. We are human beings. We have hierarchy in our thought process. But whatever, as much as we can, if we can reduce that discrimination, that is called equality. Equity is very important. And I find that if you discriminate people who are not well off, they get very offended. Poor people, and that is one of the reasons why people look at doctors negatively, because subconsciously we tend to discriminate. So we must try to respect the poor people as much as possible. I'm not saying that you do it all the time, but this is and use technology to do all this. We have to use technology to do fast. Yesterday, one of the journalists asked me, sir, that, yeah, India, I said, India is just 70 years old. The oldest hospital in London is how old? Madam, do you know? What is that hospital name? It's the St. Bart's Hospital. Do you know how many years old it is? You will be shocked. 900 years. It is a 900-year-old hospital, St. Bart's Hospital. That old is their civilization. 900 years. Our civilization is just 70 years. What progress we did in that 70 years. And how did we do it? By technology we did it. So within 200-300 years, we'll reach that level of parity, where every road will be there. If you go to UK or USA, every road, the last mile is having a cemented road. That parity will come to India maybe in 200 years' time. It is difficult. Such a large country it is. So we also have to, whatever small way, we should also help these people. And so I would like to thank Madam Upasana. Today you did a fantastic job. Your hospital did those 200 people, 220. Now you will say, क्या डॉक्टर पाई 220 है, हमारा तो 1.3 बिलियन, आप पागल हो गया क्या? क्या ताली बजा रहे हो? 220 से क्या होएगा? नहीं, but that 220 will contribute. हमारे मराठी में एक proverb है, थेंबे थेंबे तळे साचे. Small drops make a pond. And we are doing whatever we can in our own small way. It all will ultimately contribute. And that's how the maternal mortality rate has gone down. Sir, 300 से 113 होगी, and United Nations का developmental goal जो है 70, वो तो क्या हम definitely कब्जा कर लेंगे 70 को. So because of all of you, so thank you very much. So this yatra is going to go on, and thank you very, I must thank all of you, because last moment you arranged this program. बट मेरा और बीवी का यही है डिफरेंस है. शी इज़ वेरी स्ट्रक्चर्ड एंड मैं ऑलवेज लास्ट मोमेंट आदमी हूँ. बट so I'm always enthalpy. It's called chaos, but through chaos comes progress. Rapid progress is always through chaos. Thank you very much.
I would request Bhavtosh sir to say just a few words. And
आदरणीय डॉक्टर पाई साहब, डॉक्टर अरोड़ा, डॉक्टर रचना जी, डॉक्टर पांडे, डेफिनेटली गरिमा जी, डेफिनेटली कुंजन जी और ब्यूटीफुल डॉक्टर्स, आपका जो प्रोग्राम आज एनीमिया का है, तो ये महिलाओं की प्रॉब्लम भी है, एडोलसेंट बच्चों की प्रॉब्लम भी है, ये पूरे कंट्री की प्रॉब्लम्स है. अब जैसे अभी डॉक्टर साहब ने बताया कि इस देश में इतने लोग जो है डिप्राइव्ड हैं, तो ये हम लोगों के धीरे धीरे प्रोग्रेस करेंगे उसी की प्रॉब्लम से. पर एनीमिया के लिए सरकार बहुत सारा काम करती है. हम एडोलसेंट पे भी बहुत काम करते हैं, RVSK के द्वारा भी बच्चों पर भी काम करते हैं, और हम महिलाओं पर भी और उनके प्रेगनेंसी ANC पर भी काफ़ी काम करते हैं. आज आपने कैंप लगाया 200 लोगों को, ठीक है. मेरा आप सबसे अनुरोध है कि हम कुछ डिप्राइव्ड एरियाज़ को भी चूज़ करें, जैसे खोड़ा है, लोनी है, और जो रूरल एरियाज़ हैं, तो हम बहुत अच्छा प्रोग्रेस कर पाएंगे. इसमें जो कुछ भी मदद मेरे द्वारा आपको चाहिए, मैं वहाँ पर तैयार रहूँगा, आपके कैंप के साथ रहूँ. आपको आयरन, फॉलिक एसिड, किसी मेडिसिन की ज़रूरत हो, या टीम की आवश्यकता हो, या कुछ इन्वेस्टिगेशन की आवश्यकता हो, तो मैं आप लोगों के साथ रहूँगा. धन्यवाद. जय हिंद, जय भारत.
ma'am, a few words.
मंचासीन सभी लोगों को मेरा नमस्कार. डॉक्टर पई, अलका पांडे जी, यशोधरा जी, RC शर्मा जी, हमारे भावातोष जी, एंड माय डियर फ्रेंड अर्चना, एंड ऑल दोज who invited me here. So I am really thankful to God that I am actually part of this very good mission of FOXY, that you people are thinking about eliminate anemia, which is a big problem for females. ईश्वर की कृपा से मुझे बहुत सारे फोरम्स में जाने का मौका मिलता है, और अभी मुझे आकाशवाणी ने भी बुलाया था, रेडियो FM ने, महिला एम्पावरमेंट. देन आई टोल्ड देम कि यू आर नॉट गिविंग न्यूट्रिशनल फूड टू गर्ल्स. आई एम नॉट टॉकिंग अबाउट दोज हु आर सिटिंग इन दिस हॉल. वी आर प्रिविलेज्ड, वी आर ब्लेस्ड, बट एवरी फीमेल इज नॉट लाइक दैट हु इज गेटिंग ऑल द न्यूट्रिशनल फूड और ऑल द कम्फर्ट्स. तो एनीमिया एक ऐसी बीमारी है जिसके लिए एक्चुअली अगर हम प्रेग्नेंट फीमेल से शुरू करें और जो बच्ची है उस तक पहुँचें, तो ये जो आपका अभियान है, इसमें यशोदा हॉस्पिटल और उपासना अरोरा पूरी तरह से आपके साथ हैं. हमने लोनी का एक स्कूल लिया हुआ है, कस्तूरबा गांधी, जिसमें 100 बच्चियां हैं जिनकी मैं देखभाल करती हूँ. आई विश नेक्स्ट कैंप हम वहाँ लगाएं. उन बच्चियों को जिस चीज़ की ज़रूरत हो हम उन्हें समझाएं और वो सारी चीज़ें उन्हें प्रोवाइड कराएं. साथ ही साथ मैं अपने और फोरम्स में भी आपके इस अभियान को बताऊंगी और बाकी लोगों को भी, क्योंकि मैं सारे ही चैम्बर और काउंसिल्स में चेयर या को चेयर हूँ. आई वुड लाइक ये जो सिर्फ फॉक्सी तक ना सिमटे, ये जो आप लोगों ने इतना बड़ा मिशन चलाया है, इतना बड़ा अभियान, इतना रोड पे चलना आसान नहीं है. पूरे दिन आप जा रहे हैं, फिर आप प्रोग्राम कर रहे हैं, फिर आप जा रहे हैं. तो इसमें हम लोगों को बहुत सारे लोगों को जोड़ना है, साथ में समाज को जोड़ना है, ताकि अगर बच्चे माल न्यूट्रिशन के शिकार ना हो तो आगे एक स्वस्थ समाज जन्म लेगा. और उसके लिए ज़रूरी है कि हमारी बच्चियां स्वस्थ हों. तो इसमें मैं आपके साथ हूँ और आप मेरे साथ रहें. तो मुझे लगता है ये दोनों पक्ष जब मिलकर काम करेंगे तो हमें आगे बढ़ने से कोई नहीं रोक पाएगा. आप सबका बहुत बहुत धन्यवाद. एंड डॉक्टर पई, आपको तो मैं स्पेशल थैंक्स कहती हूँ. यू आर डूइंग अ वेरी डिफरेंट थिंग which is first time in India somebody is doing like this. ये यात्रा, ज़्यादातर पॉलिटिशियंस यात्रा निकालते हैं वोट्स के लिए, लेकिन आप लोग जो यात्रा निकाल रहे हैं, इसलिए मेरे ख्याल से आप लोग सब लोग अपने लिए ही तालियां बजाएं. फॉक्सी, केमॉक्स, that we are doing the best job for society, for females and for everybody, because स्वस्थ रहेगा इंडिया तभी तो आगे बढ़ेगा इंडिया. धन्यवाद.
Upasana ma'am for such kind words. I will request Dr. Garma to please hand over the mic. I think यहीं से हम शुरू कर देते हैं, जैसे मैम दो शब्द बोलें.
को सादर प्रणाम. और मैं आभारी हूँ अपने अध्यक्ष डॉक्टर पाई की, जिन्होंने मुझे ये मौका दिया है यहाँ आप लोगों के बीच आने का और शायद कुछ बोलने का भी. और सर की यात्रा के बारे में आप सुन ही चुके हैं. इन्होंने बहुत बड़ा विज़न लेकर सारे यात्रा का प्रारंभ किया है. और एक चीज़ और मैं बताना चाहूँगी कि सर का विज़न है कि हर महीने के 18 तारीख को एनसीडी का कैंप्स हो, और एनसीडी यानी कि कैंसर, अनीमिया, ब्लड प्रेशर, इस सब की जांच हम लोग मुफ्त में करें और अपने महिलाओं को लाभ पहुंचाएं. और हम लोग इस मिशन में डॉक्टर पाई के साथ हैं और उनके साथ हैं और उनके साथ मिलकर काम करेंगे. धन्यवाद.
सभी को सादर नमस्कार. मुझे डॉक्टर पाई के, हमारे प्रेसिडेंट के सहायता से ये मौका मिला है कि मैं आप लोगों को एक धन्यवाद दे सकूं कि आपने मुझे वोट देकर नॉर्थ जोन का वाइस प्रेसिडेंट बनाया. शायद मैं अकेले नहीं आ पाती, प्रेसिडेंट डॉक्टर पाई की वजह से ये संभव हुआ है, बिकॉज यात्रा उन्होंने की और पूरे नॉर्थ जोन में ही इज़ कवरिंग सो मेनी सिटीज़, 40 सिटीज़ ही इज़ कवरिंग. तो एक हमें भी मौका मिला आप लोगों को धन्यवाद देने का एंड डॉक्टर पाई को धन्यवाद देने का कि सर इट इज़ बिकॉज ऑफ यू ओनली वी आर डूइंग द थिंग्स. और जैसा कि अभी डॉक्टर अलका ने बताया कि ये बदलाव, और डॉक्टर पाई ने बताया ये बहुत ही इम्पॉर्टेंट है. ये जो स्लोगन है ना, इट रियली मीन समथिंग. जो इक्वलिटी है वो एकाकीकरण और इक्वलिटी नॉट ए ईजी थिंग विच ही हैज़ स्टार्टेड. वी मे नॉट बी एबल टू डू इन 1 year, but if the seeds are sown, I believe into it that if you see the seeds, they will ripe at one day and you'll see the change. So it is the thought which is important, and which is a very good thought, sir. I am really thankful to you that you have thought for it, that you want to bring the unity, equality and technology. Technology we are using, but we have to use in a positive manner, and because we are associated with the health, so we should do it for the health. As Mr. Santosh Yadav were here, and he said that about the school education. So education is a primary thing and for everything. So I do not want to say much. It is so many people have to say so many things, but Badlav is one thought. The seed has been sown, and we will work not for 1 year, for years to come, and so many young generation is there. Please remember this. Unity and equality and technology is a very, very important. जो उपासना जी ने कहा, इंडिया स्वस्थ रहेगा तो ही आगे बढ़ेगा. इसके लिए बहुत ज़रूरी है तीनों ही स्टेप्स. थैंक यू सो मच.
थैंक यू.
और ये हमारी जो कोरा माखनपुर की टीम है, इसके लिए तो बहुत 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 धन्यवाद. इन लोगों ने जो हम लोगों को इज्जत दी है वो शायद हम लोग कभी नहीं पाएंगे. और गुंजन, गरिमा, नीता, there's so many my students. So I really feel very privileged to be here. Thank you so much.
Thank you. We feel privileged to be your student, ma'am. It's our privilege. अर्चना वर्मा मैम, 2 शब्द मैं वहीं पे आपको माइक दे देती हूँ.
Thank you KMOX team and the Foxy president. Actually, we always talk about anemia and the prevention. You know, for any thing to understand in India, it's such a vast country, so many states and so many problems, and 90% of the India living in the rural. So this, as Mahatma Gandhi said, अगर आपको किसी देश की नब्ज पहचाननी है, उसकी बीमारियों की नब्ज पहचाननी है, आपको यात्रा करनी पड़ेगी. तो डॉक्टर पाई का जो ये मिशन है, यात्रा, आई थिंक ये सक्सेसफुल होगा. और एजुकेशन सेक्रेटरी सर जो कह के गए हैं, 6,000 स्कूल, 6 लाख गर्ल्स, तो ये जो हमारा है, और 6 इनिशिएटिव ऑफ government. So this will be a great initiative. 6 initiative of government, you know, सिक्सर पे सिक्सर लगाने ही पड़ेंगे हमें, तो ये हमें याद रखेंगे. और right from gynecologists can really do wonders, because right from the active management of labor, where we are doing late cord clamping, which is preventing anemia, then taking care of the girls, so, and of course all the this thing. So prevention of anemia is very, very important. Fortification of iron diet, and all the just giving tablets and doing all the test regularly. So that will be एक दिन में तो कुछ नहीं बदलता, but आपकी अगर confidence है और आप में commitment है, तो ये दो चीज़ें इस चीज़ को बदल के ही रहेंगी, और ये बदलाव आगे ही रहेगा. I really want to say good and best wishes to our Foxy team and Garima team. Okay, thank you.
To please say a few words.
Thank you. First, I would like to take this opportunity to thank the Foxy, the president of the Foxy, Dr. Gunjan, for giving me this opportunity and honoring at this beautiful occasion. Thank you very much, Dr. Pai and Dr. Gunjan. This Nari Swasth Jagaran Andolan or what Yatra is really a very beautiful idea. I must appreciate it because it is coinciding with the objective of the Pradhan Mantri Suraksha Matratya Abhiyan. And this is one of the very good initiative taken by Government of India. Where, as we know that though India has made a significant progress in this direction, if you look at the MMR data in 1990, when we were having around 580 maternal mortality per lakhs, but it went down. I think it was 70% reduction in few years. Still we have a long way to go, and under this Pradhan Mantri Suraksha Matratya Abhiyan, one of the important factor is that we have to improve the quality of cares of antenatal both at a second and third trimester. But with this, I think the dissemination of the information and the counseling is one of the important part. And by organizing such type of yatra, particularly for the anemia, I think you are going to address the issue of this big program of Government of India, and I wish all the best for your future endeavor. Thank you very much.
Thanks everybody for the way things have gone, and every time, you know, there are few faces which take the limelight. We as females always get the limelight, but actually there are a lot of people who will work with us, our husbands, our families, our team IMA from Ghaziabad, and our very good friends. So I will request Dr. Pai to please felicitate our friends and extended family who have helped us greatly in this event. I will request Dr. Pai to please felicitate our past president, Dr. P.N. Chaudhary, our president-elect, Dr. Vipul Tyagi, my very close friend, Dr. Sanjay Garg, and of course, my dearest husband and a great friend of mine as well, who helps me in everything, Dr. Pradyot Govil. डॉक्टर विपुल त्यागी, गरिमा तुम भी जाओ ना साथ में सर. डॉक्टर संजय गर्ग, and of course our secretary Sanjay. हाँ, Sanjay has been instrumental. Dr. Pradyut, and of course, our secretary of IMA has just left due to some reason. I will request. Dr. Monica will take on Dr. Amit's behalf. And Dr. T.S. Pal, please come. He has helped a lot. He went with us in the morning. I will request Dr. Somnath to please felicitate our dearest Sharda Jan ma'am, who is sitting there. Ma'am, a round of applause for ma'am, please. And now we have Mr. Abhijit, a senior India. Mr. Abhijit, please come to the stage. From Times of- He's a very senior journalist. Acha, Sharda ma'am is coming. Oh, a pleasure, ma'am. Please, ma'am, आइए, please, please. कोई बात नहीं. Thank you. Mr. Abhijit, please come from Times of India. Dr. Pai, our president of Foxy. Thank you, Abhijit, आने के लिए. Thank you. Hand over the stage to Mr. Priyankur. We'll begin with a public forum. I'll just play a short bite. ये जनरल वीके सिंह की बाइट प्लीज प्ले कर दीजिए.
For this particular program that we are implementing, we are taking out awareness stand as part of our Jan Andolan commencing from Rishikesh.
एक मिनट कैन वी प्ले इट अगेन.
Organization
पीछे कर दो. हाँ सर मैं आ गई, पीछे आ गई हम. मैम आइए, अर्चना मैम. गरिमा मेरे साथ पीछे आ. गरिमा इधर आ. हाँ और क्या, आ जाओ आ जाओ आ जाओ. अनीता आना. डॉक्टर दीपा यार खुद ही आ जाओ. छवि, आराधना, डॉक्टर नूपुर, मिशु, अक्षता, दीप्ति दुर्गा जैन, डॉक्टर प्रीति अग्रवाल. अटेंडेंस लग रही है. प्लीज डॉक्टर मीनाक्षी, रोल कॉल. डॉक्टर अर्चना गुप्ता, प्लीज डॉक्टर पूर्णिमा वाजपेयी, डॉक्टर सुमन गर्ग. Who else? Somebody, Dr. Rajshri. Please do come. रिचा आ, दौड़ लगा वहाँ से. जगह नहीं है. चाय. Please दौड़ो दौड़ो. हाँ. नाम नहीं पता. वो डॉक्टर नहीं है सर. जसवी भी आ गई है. चलो स्टार्ट. डॉक्टर भाई का बदलाव दिया हुआ है. हाँ. ये बदलाव है. जब नारी सुखी रहेगी तभी परिवार सुखी रहेगा. हेल फॉक्सी. और ये कैमरा वाला पीछे जाता हुआ, क्योंकि सब लोग नहीं आ रहे हैं. किसी को काटना मत प्लीज. थैंक यू. हाँ मैं तो कह रही थी. वीडियो. हाँ. नाना नाना एनीमिया. ना एनीमिया. एनीमिया. Anemia. Of course, here we are all here on this side. This event would not have been possible without PNG, who has supported us in a big way. Thanks to PNG for all the sponsors.
जरा एक मिनट रुको जरा. प्रियंका, just get the jacket please मैडम के लिए. मैडम प्लीज, आप ये बरस मैंने फॉक्सी का पिंक कलर यानी हेल्थ का कलर किया है.
हाँ डिस्पोज. हाँ ये बहुत ज़्यादा है. 3 चेयर हटा दे बस. उधर से 3 हटा दे या इधर से हटा दे. हाँ हल्का सा Dr. R.S. Sharma, Dr. Bhavtosh Shankdar, sir has already left, I think, due to constraint of time. So, Dr. R.S. Sharma to please come to the stage. Dr. Raka Singh to please come to the stage. Dr. Raka Singh is a senior gynecologist in this area. Ma'am, please proceed to the stage. I will request Dr. Manju Barik, who is a very senior gynecologist in our area, to please come. Dr. Vinita Rastogi, who has been with us and a very senior gynecologist in our area. Vinita ma'am, despite her poor health, she has come. So it's welcome ma'am. And I think Dr. Anita and Dr. Seema, would you like to please come? Seema ma'am, we also have Dr. Poonam Goel with us. Dr. Poonam Goel. Sir, R.S. Sharma, sir. So please for the public forum.
Public forum, we'll keep it very short. Some take-home messages for all of us who are present over here. It makes my job very simple today because we have all gynecologists present with us, and of course, sir, who's a scientist from ICMR, sir is also there with us. And we'll quickly do this public forum to look into the perspective, individual perspective of everyone to a girl from womb to tomb. So right from womb to what are the things that we require usually to take things properly, till the tomb, what are the things that would be required for a healthy life. So first of all, we would like to thank Dr. Rishikesh Pai sir for this wonderful Yatra program that we have started. And we have excellent, I would say, panelists or experts who are present over here. And I'm really delighted to have all the experts, including Dr. Sharda Jain ma'am, whom I must confess I'm a little scared of. And I'm really a little scared because she's sitting in the panel over here. But I'll go ahead with this session, of course, and it's a privilege to be here. So I would like to start, of course, with the first thing first, and the most important we know after birth is immunization. And immunization protocol at birth should be standardized according to the Government of India directives and the IAP guidelines, and to a certain extent, to a huge extent, I would say, the Government of India has been successful in doing the same, and we are following this protocol quite successfully. Things over here that we look at, and we look at the different months. Of course, there are vaccination schedule that is present from the first, second, third, fourth month, 6th month, 12 months, and last of all that we see over here, the vaccination that can be given at 16 to 18 years as well. So this is another important thing that I would like to talk of, and good touch and bad touch. And I would like to come to Dr. Mridula ma'am, and I would like to ask her, ma'am, just your inputs on what is your perspective, what do you feel? We do talk a lot about women, empowering women, but we have probably forgotten to empower or to teach our men to live with this empowered woman. What do you feel is the importance of teaching our boys about good touch and bad touch, especially in their younger days? You can take the mic.
I think it is equally important to teach our boys also. I remember an episode when they were very small kids. I have 2 sons. They were very small. When I told them about the bad touch to them, they said, "Mummy, kitni gandi baat."
This is a wonderful example, I would say. Yeah. Being a mother, you talked about a bad touch, yes, and that makes so much more sense.
Yes, yes. And we would keep an eye on them also and tease them. That time they said, "Oh, Mummy, kya baat kar rahe ho?" But you know, this is equally important, I think so.
Absolutely.
Yeah.
And I think this is one of the most important aspects today that a boy needs to be taught.
Yes. We don't take care of the boys. We just forget about them and just
yes. So
focus on girls only.
Yes. So I feel really ashamed when there are guys who talk of all these crimes, rape, etc. happens in India because of girls wearing short clothes. But who restricts guys from wearing short clothes, and who restricts them, and who does not teach them rather that everyone is allowed to wear short clothes, and it's not only that boys can wear and girls cannot wear, and it hampers their safety. So protecting children is everyone's business. We need to talk of the right to education, and I would like to come to Dr. R.S. Sharma, sir. If I can just ask your inputs, because you have worked a lot toward maternal and child health, and I would like to ask certain inputs of yours. What do you feel the right to education has helped children in what ways?
Actually, right to education is really a fundamental right given by the Constitution of India. And with a specific reference to the girl child, because I always believe that if you educate a girl, we educate a family. But as the previous question was raised, that education to the boy is also equally important, because whatever is going on in this country, so far the safety of the girl is concerned, the crime is concerned, somewhere the parents are responsible for that, because we are giving all the responsibility to the girl only. But boy is always considered that no, boy is boy. We don't, he will be taking care of himself, but it's not like that. I think we have to teach give the sanskars or the education, correct education. Education doesn't mean only the classes where you are, but you have to give a correct education, how to respect others, how to respect the women, how to respect the girls. I think at home, these are very, very important, because these type of educations comes from the home only. Thank you.
Absolutely. Please do. Thank you, sir, for your inputs. Anita, ma'am.
Yeah, I just wanted to add, जैसे सर ने ये इतना अच्छा एक हमें अवसर दिया है अनीमिया से अवॉइड करने का, भारत को अनीमिया मुक्त करने का, अनीमिया हटाने का, एडोलेसेंस में भी इसकी इम्पोर्टेंट है. जैसे कि सर ने कहा, एजुकेशन के लिए एनीमिया का मिटना बहुत ज़रूरी है. हमें पता है that boys or girls who are anemic have poor school performances. So we can very well correlate education with eradication of anemia in adolescents also. So that should also be an important aspect when we are dealing with school children or adolescents.
Absolutely. So adolescent care is of utmost importance. So next, moving on to another important topic. Of course, the child has grown, taken vaccination, and has come to a stage where she's starting to menstruate. The menstrual age of the woman, the adolescent health. And I would like to come to Sharda Jain, ma'am. And I would like, ma'am works a lot towards menstrual hygiene, and she propagates menstrual hygiene in a great way. So ma'am, what is your perspective towards teaching an adolescent towards menstrual hygiene, and what do you feel, how do you feel is school education is important towards this aspect?
I think as far as the menstrual hygiene is concerned, everybody realizes it. The poor and rich, everybody realizes. The poor cannot acquire things, and I'm glad many states have come forward that right in the schools, the sanitary napkins are given to them. In Anganwadi, the sanitary napkins are given to them. And I think the time is not far away that all states will be doing that particular thing. So it is only that, the foxy and things like that need to press them time and again. The states where it is not being done, I think this particular thing should be done. Like in Delhi it is done, in Haryana it is, in Punjab, in Rajasthan it has been done, but in Haryana and UP we have to push it. So I think this is what the pressure has to be made by the foxy organization like this. Everybody realizes the value of hygiene.
Absolutely. So again, as has been talked of, I would again say that education starts at home, learning starts from home, and again the similar way, menstrual hygiene, menstrual products. And when I talk of this, I would definitely like to mention, try and avoid artificial pads, etc. as much as possible. It contains a chemical called benzol, this is for all of you. Please do propagate the same in your clinics as well. Benzol is a chemical, benzol A rather, is a chemical that can cause cervical or vaginal skin cancers, etc.
I wish to draw your attention. Not a single company in this particular country is making the ideal dioxin-free pads.
Yes.
One company brought it from outside, the pressure was then he winded up and gone. Not a single company is there, so the pressure has to be there.
Absolutely. Important point noted, ma'am, and we will have to propagate a little bit of usage of cotton pads. Probably that would be of some help, and also maybe of menstrual cups, because nowadays the menstrual cups are quite freely available, and this could be something, if the lady is comfortable, could help us in preventing what Sharda ma'am has just mentioned about.
I'm glad that some of the southern states are you know, they are producing natural fiber being used in sanitary napkins. So they are always better. They are using seaweeds, even coconut shell fibers. They are, you know, modifying it and making sanitary pads. I think it will go a long way regarding the matter, Dr. Sharda Jain. Yes. Yes.
Uniformity for the same. Government has realized it. So if the government has realized it, why a couple of states are doing, but a couple of states are not doing it, I think it has to, pressure has to be maintained.
Absolutely.
And take it from me, sanitary napkins, me and Dr. Archana Verma, when she became vice president, I did tell her that now utilize this particular thing, that at least you press on the pads. But you know, it's a simple process, and I think things can be done.
Absolutely. So we all know cigarette packets. Yeah, go on.
I just wanted to know that what we are doing for the rural areas. Urban area awareness is way better, in fact, what it was there in past. And we are working mostly in the urban areas only.
Ma'am, but I'd just like to interrupt once. Ma'am, urban area, rural, we do agree with what you're saying, because rural areas awareness has to go more in a diligent way. But again, if you look at, we all have this small pawn shops where we have cigarette packets which say tobacco causes cancer. And in the urban areas, this tobacco is smoked the most. So basically, we definitely need to propagate more of awareness, but then ultimately we need to make that person aware what is exactly happening. Though people know that it causes cancer, it's an addiction, that this may be a difference between pads and that may be a difference between cigarette, but again, we need to do a little bit of more propagation both in the urban and rural area. And as you say, I would also like to mention one thing. People in the urban area feel that if they have a patch which are thinner, which probably sticks on, it makes things a lot easier. But you know, those are the things where we have these chemicals more. So cotton pads may be bulkier, but they are much, much safer, which needs to be propagated. And that is why we are here to say this, that in the clinics, etc., in your clinics, you need to propagate this. Yes, sir.
ग्रामीण परिवेश में मैडम आपके प्रश्न का मैं जवाब देना चाहूँगी. यदि लड़कियों को हम सिखाते हैं, जैसे प्रियांकुर ने बोला, चीपर ऑल्टरनेटिव्स भी अवेलेबल हैं अब, या तो आप मेंस्ट्रुअल क्लॉथ के पैड्स यूज़ कर सकते हैं, परंतु हमें अपनी जो बालिकाएं हैं उनको सिखाना होगा कि वो कैसे उसको धोएं और कैसे उसको धूप में सुखाना है. वो ना शर्माएं, वो शर्माती हैं, उसको छाया में छुपा के सुखा देती हैं. तो एटलीस्ट इतना हम आगे बढ़ सकते हैं, उनको ये शिक्षा तो दे सकते हैं कि अगर वो रीयूजेबल क्लॉथ पैड्स यूज़ कर रही हैं, या वो अंडरगारमेंट्स जो होते हैं एब्जॉर्बेंट, वो भी आ रहे हैं मार्केट में, जो कि मेंस्ट्रुअल हाइजीन के लिए प्रोडक्ट्स बने हैं, तो वो उनको कैसे धोएं और कैसे धूप में उनको सुखाना है, उसको कैसे हाइजीनिकली यूज़ करना है. तो हम ये आगे इस तरह से हम बढ़ सकते हैं ग्रामीण परिवेश में. मैं खासकर बात कर रही हूँ.
Dr. R.S. Sharma, sir, your inputs?
Yeah, actually,
Ma'am, we'll just take his inputs, then we'll take your inputs, please.
इस संदर्भ में एक बात मैं कहना चाहूँगा कि जहाँ तक मेंस्ट्रुअल हाइजीन का सवाल है, ICMR initiated this big program when I was the head of the division, and I focused on developing the menstrual hygiene by using the jute from the jute Calcutta institution, because there's washable also, and I did some study also, we are quite safe. We recommended to the government of India, but our basic problem is that health is a state subject. Because of that, some states are following, others are not following. So here, this is the basic bottleneck in this.
Exactly what Sharda Jain ma'am had mentioned. Because the thing is, until and unless it is followed, things become definitely a problem. Ma'am, you want to add on something? You were saying something. Do you want to add on?
Movies also, small movies, like Akshay
Mic, please, ma'am.
One advertisement, which I think really helped. When he was saying कि 2 रुपए का आप सिगरेट खरीद सकते हो और आप
Yes.
बैग खरीद सकते हो, that actually helped. I think.
यहाँ मीडिया का रोल आता है, जो हमारे मीडिया के लोग हैं.
Ma'am, Anganwadi is under ICDS, which is a central government program. It is being distributed. They get the thing for every month. What is not there in the schools when they are being distributed, state has to take it up. Many states have done it, but the pressure has to be there on the states.
Absolutely.
That up to class 5 or class 6, the napkins are available for them.
And I'm so happy to say that a small state from Northeast India, Arunachal Pradesh, has gone and they have made now menstruation-friendly schools, where they have segments where the pads can be disposed. These young girls who can go to school, and those are the places where people walk almost 8 to 10 kilometers to reach a school. So this is definitely something that we need to
When we talk of menstrual hygiene, another thing important is wash. Means
they should have places, they should have toilets, girls should have access to toilets, they should have access to water
Exactly, yeah.
so that they can
Yes.
clean themselves in schools. So this is our responsibility, how to, raise awareness in the community.
Manju ma'am, can I come to you next, please? Can I ask you about sex education in schools? What do you feel about it?
Definitely, health and sex education should be the part of the schooling, because everybody knows that the teenage pregnancy is very common, not in, especially abroad and India also. And if we give the education about sex and how to protect them, not only they are protected by the unwanted pregnancy, but the sexually transmitted disease.
So I think
we should not shy them, and we should not shun them. And if they are asking about the sex, we should educate them.
Absolutely.
And to prevent all these.
I think as has been talked in the famous movie, The Pink, no means no. That is something that we need to teach our girls. No means no, and teach our boys also rather that no means no, and there should be no aggression after that.
Yes.
Okay, so vaccination. Now, I would definitely like to ask Dr. Seema Varshe, madam, and after that I would like to take in inputs from Dr. R.S. Sharma sir, because I'm sure from ICMR they've done a lot of research towards HPV cancer vaccination as well, and we'll take his inputs towards it. So Seema Varshe, ma'am, can you tell us in HPV vaccination, how do you feel it will help, and how is the program that you want right now? What are the changes in the program, or how do you want it to be propagated? For more reach, basically.
For cervical cancer?
Yes, HPV vaccination.
Yes, there are two vaccination, Gardasil and Cervarix, bivalent and quadrivalent. And
we have the nanovalent as well now, which has been recently launched.
Yes, yes. And we are doing starting from 9 to 9 years, and from 9 to 15 years, it will be single dose and booster for after 5 months, and 15 to they say that 35, even at 35 or 40 years you can give, and you can protect the women for cervical cancer, and there will be 2 doses 1 month or 2 months apart in Gardasil and Cervarix, and booster will be given after 5 months, and this will protect for these cervical cancer.
Perfect. So I would take inputs from sir. And before that, I would just like to mention once, and this is so very important now, that we need to propagate this in our clinics, that cervical cancer vaccination has been included in the Government of India program, and it will be available in the National Immunization Program and has to be utilized by our patients. The cost of it will be much, much lesser, and as ma'am has said, 1 dose WHO, initially we had talked of 3 doses, now they have said that 2 doses are adequate, and for places where its financial constraints are there, even 1 dose is good enough. So this needs to be definitely propagated to our patients. So yeah, inputs regarding HPV vaccination if you want to talk of something.
I think the government of India has already initiated this program, and going to be a very important program, particularly for cervical cancer. And through the network, whatever we are having, it will be a quite successful. Serum Institute has already promised us, so I think that is going to be a success.
Perfect. I will just, yes, please, ma'am.
As far as the vaccination is concerned, the Government of India has realized it. It is committed to give it in the National Immunization Program, and it will be rolled out to all adolescents. Now the question is, it has Serum Institute of India vaccine. The SAGE has said that the Gardasil 1 dose is enough. The SAGE studies has said 1 dose is enough, not only till 15. The people who are not exposed to sex up to 26 also 1 dose can be given. But as far as our indigenous vaccine is concerned, things have to be worked out for that.
Absolutely.
Ma'am, the vaccine can be given to boys also, as it's not only for the girls.
Yes.
At this particular time, the priority in the National Immunization Program is only for girls. Only subsequently it will be taken up for boys.
As you said, ma'am, boys can take the vaccine, but as ma'am mentioned, in the immunization program, it's right now included for the girls alone. Boys may be included subsequently. Very good points, good inputs. Poonam ma'am, if I can just come to you with this question of what do you feel about child abuse, child sexual abuse, and what do you feel the girls who get abused at home, what do you feel how we can help them out?
I think our girls should be empowered, and they should know what law is behind them, and whenever there is any abuse, they should be aware where to report, first of all to her mother, to her elders, and then
At
to
home.
her school teacher, then to
Yes.
her principal, and still if the things are not going well, then with her parents or with some adult, she can go to police also and lodge a complaint there also if there
Yes.
the things are not working out good
Perfect,
for
ma'am.
her.
So basically, if it's a abuse at outside, definitely parents are the first source. But in case if it is at home, then we need to realize teachers, sometimes doctors also play an important role because they might come to us. And we also need to understand by the rules, we should not shun examining them, but it's best to inform the police and then go ahead with examining this woman. Because is this girls? Because it's a major trauma that we need to understand. All of us need to have this number 1098, which is a child helpline number. And if there's anything of this act, anything related to the POXO Act, you need to call up this number and reporting is a must.
There are some red flag signs in the
Yes.
behavior of children. We should read them and get alert because these are very important.
Absolutely. So we will move on next
Another
to...
thing, Priyankur, is sometimes we get children. They may not tell you about the abuse directly. Very well highlighted by you, ma'am. There are subtle signs. And if you find that the child is having, sexually transmitted disease, there is an indication that may be an indirect sign that the child is being abused. So we should take a very, careful history. The child may not come out on first meeting.
Perfect,
You may
ma'am.
need to call them again
Yes.
and again, and then they will open.
We need to spend some time with them and talk to them. Perfect, ma'am. Can I next come to Dr. Raha Singh, ma'am? You have been quite through the panel now. We'd just like your inputs towards prenatal counseling or pre-pregnancy counseling. And what do you feel is the role in this counseling towards anemia prevention?
Yeah, it is very, very important because the girl who is going to have this in the childbearing age, she is going to marry. We have to tell them because sometimes they take, they become pregnant and they take pills. वहीं से start हो जाता है उनका anemia. अभी pregnant हुए हैं, pills ले लिया because they don't want this pregnancy is unwanted because they don't have this excess. But they have excess of the pills. That is very, very grave thing. They are not at all, they want to come forward when they get married so that they should get some kind of
So contraception along with,
contraception
yes.
advices. But over-the-counter pills are available. काम वाली बाई वो bleed करती
But in some states, ma'am, actually the stats have come out quite well, like state of Gujarat.
From the media, वो जो सर कह रहे थे कि नहीं उसको ठोक-ठोक के
Yes.
बताना चाहिए हमको एक मीडिया के थ्रू बिल्कुल
Yes.
उनके दिमाग में भरना
Yes.
चाहिए कि एक contraception भी कोई चीज होती है.
Yes,
Otherwise-
absolutely agreed, ma'am. The similar comment as Shada Jain ma'am said, every state the rule has to be on an equal level, and that makes sense. In the state of Gujarat, it's not available free of by the counter. You have to go to a doctor, get yourself examined, and you can get the pill through the doctor.
Yeah.
So that is probably something that if it's implemented across, I think that would probably help us.
And
Yeah.
contraception advice is very, very
Yes.
important.
So, and another thing that we would like to definitely say after prenatal counseling, of course, for delivery, institutional delivery. And for this, I would definitely say institutional delivery maybe on a private level or also on a government level, which is very helpful. And one small example for this, I would say, is the government of Tamil Nadu. Tamil Nadu government right now, the hospital deliveries, I mean, there are doctors whom we talk to, they have got their nursing homes, and they are a little sad, not little, a lot sad because of the fact the number of deliveries have gone down drastically. Two simple steps that they have done. Number one, they have given an incentive. In the first trimester, if a patient undergoes full checkup over there, they give an amount of 6,000 rupees to each patient. Second trimester, 6,000 more. Third trimester, 6,000 more. And once you deliver in a government hospital, they get 6,000 more. So it's 25,000 that a hospital or the government is giving to a patient who is delivered, rather than they paying us 25,000 in our nursing homes. So that is sort of an initiative that has gone on a long way, and the mortality in, as Sir has said, in Tamil Nadu has come to 32 MMR. That's a wonderful number. We were given a goal of 28 and they're already at 32. So if,
सेंट्रल गवर्नमेंट के इनिशिएटिव्स जो है जननी सुरक्षा योजना और जननी शिशु सुरक्षा कार्यक्रम, ये दो बहुत इंपॉर्टेंट पिलर्स हैं जो कि मैटरनल मोर्टालिटी कम कर सकते हैं. एंड दीज दे आर इंसेंटिवाइज्ड, द मदर्स आर इंसेंटिवाइज्ड टू कम एंड अंडरगो रेगुलर एंटीनेटल चेकअप्स एंड हैव इंस्टीट्यूशनल डिलीवरीज. डॉक्टर शारदा मैम वांट्स टू से.
yes, ma'am, your inputs, please. Yes, ma'am.
As far as the institutional deliveries are concerned, I think all of you should know it is 95%.
Yes.
deliveries are taking place. Now, this is what I feel not only in Tamil Nadu, you can see in whole of Rajasthan. All deliveries are happening in the government sector.
Yes.
Part of UP it is happening in government sector. Madhya Pradesh is happening in government sector. Gujarat is happening in the government sector. And take it from me, very slowly all maternity deliveries will be there in the government sector because of the incentives.
Absolutely. So we need to hit it right, and we need to hit at the right moment so that it's taken up well by our women as well. So next, I would like to not go into much of details into this. Okay, this is one important aspect. I'll not ask any of you, but I would just like to put in a fact, confidentiality and the trust development between you and your patient is very important, because ultimately they should be able to come and tell you what they're facing, why they could not come, and what are the problems that they are undergoing. Respectful maternity care, again, a very important thing. We will have to respect everyone. I hear a few of my friends talk of, this is a ESI patient, this is a Arogya patient, whatever it is, a woman is a woman, and every woman needs to be taken care during the delivery. You pull a curtain, cover them, and it makes things so much easier for everyone. Yeah, and breastfeeding, again, very important. I would just like to take one quick comment from Dr. Mridula. We haven't heard from you sometime. Breastfeeding and its importance quickly, and then we'll go on and finish this panel.
I think there's nothing to say about this.
No, the propagation, because ma'am, I'm sure some of your husbands are pediatricians over here. We know there are a lot of pediatricians who do propagate a little bit of formula feed sometimes. So how do we help in that breastfeeding propagation is what I want to know from you.
I think the approach of a doctor should be very soft towards them.
They do.
And should be, you know, with every aspect of antenatal checkup and later on also, if you are very soft and gentle and in explaining things, I think they'll go for it.
Talking to them, counseling.
And they do go for breastfeeding.
Yes.
Which is
Sharda ma'am, any inputs? Thank you, ma'am.
See, talking about breastfeeding in India, I think it surprises me. Because if you see the rural area, they have no alternative. They are doing breastfeeding. Because cost of 1 month of the formula feed is 500. Nobody can afford that. See, the question is, the problem is only in the urban area where this data has been collected, and they say it is 60%, you know, people are breastfeeding, and 60% are breastfeeding and 40% are not doing it. But what I feel, you very rightly said, that we must all know that the golden hour of breastfeeding is the first 1 hour.
Yes.
And we all gynecologists are big deterrent. Not at the vaginal delivery, we are not making any arrangements that the breastfeeding is started right away, and the same is for cesarean section. Few effort has been made, but I think, you know, you have to rub in gynecologist's mind, something has to be done, that within an hour, you know, the breastfeeding has to be done. And here I just wish to tell you, if they take a formula feed, big hospitals you go, it is only formula feed they give. The nurses just eyes quietly, they tell them they get your formula feed. And the formula feed, if it is given, it changes the gut flora, and which is bad for the child. And I think, you know, either the breast milk or you know, now the milk is available, of the breast milk is also available. 1 or 2 doses may be required for that particular thing, and that will prevent your child for so many neonatal problems.
Absolutely. Thank you so much, ma'am, for your inputs. Now,
I will like to know one thing, that what about the pediatrician keeping the baby under observation because of all this CPA and all for 6 to 8 to 12 to 24 hours in nursery without handing over?
I worked in tertiary care hospitals. They keep this child for 2.5 hours. But this 1 hour feeding has to be done right at the time of a delivery or a cesarean section by the gynecologist.
Right
the
after birth.
pediatricians are doing it, but they are not unnecessarily keeping it.
Ma'am, the recent, as ma'am mentioned, the recent.
अब तो डिलीवरी के बाद हम
Anita ma'am, I'll just-
बेबी को मदर के एब्डोमेन पे डाल देते हैं. बच्चा क्रॉल करता है ब्रेस्ट की तरफ माँ के, वो हेल्प करता है अर्ली ब्रेस्ट फीडिंग इनिशिएट करने में. उससे 2 चीज़ें होती है, एक तो मैटरनल बॉन्डिंग होती है बच्चे के साथ, दूसरा वो ब्रेस्ट फीडिंग अर्ली स्टार्ट कर पाता है, दूसरा टेम्परेचर रेगुलेशन. Temperature regulation, it is a part of kangaroo care. बच्चा उसके पास रहता है तो temperature maintain
we know, we say that you should do this, but
all are following, ma'am. This is being followed in public hospitals, and I think
One
in
second,
even
we'll
private
just hear her. Yes, ma'am.
unknowingly
Yeah.
because the baby is to be kept under observation.
No, ma'am, that is agreed what you are saying.
Most of the places, they keep the baby in
Ma'am
nursery.
ma'am is just talking about the initial
Only
1 hour.
one.
As soon as you have delivered, put it on the mother's abdomen is what is said.
That's it.
Because now we are delaying the cord clamping as well. Yes. Delayed cord clamping also is...
I know, ma'am, but it is not everywhere.
Only
not
those
everywhere.
babies who need observation, जिनको respiratory distress हुआ है या late cry आई है, जिनको real observation चाहिए, वो उन्हीं को माँ से अलग रखते हैं. नहीं तो अब तो rooming even नहीं, अब तो मतलब keeping the baby in bed with the mother is there.
Rightly
Absolutely.
said by ma'am, in private sector it is almost a routine.
Yeah. Okay, we'll just move on, ma'am. We'll discuss this later. Yeah, so as per Sir's initiative of cervical cancer and breast cancer, we need to do this screening quite often for a woman. And I think, yeah. And bone health is very important. Calcium supplementation, prevention of osteoporosis, menopause health, and of course anemia we have talked of already. Self-respect again is quite very important. And of course, finally, the holistic health that we need to look at, because we already have heard the politician who was here, the general secretary, additional secretary, he talked of holistic health, and that I believe goes a long way in preventing a lot of problems. Thank you so much for being part of this. And sorry I had to hurry in the end, but we have a very good CME and scientific program to follow. Thank you so much once again.
Thank you for this opportunity. Thank you, Hoxie.
Yes.
नेक्स्ट हमारा आएगा कैसे इसमें वो वहाँ से करेगा हाँ अच्छा थैंक यू डॉक्टर प्रियंका यू हैव एन आइडिया इसका हमारा पैनल है ना नेक्स्ट वेयर इज इट
He will give from there. मैं बोलता हूँ उसको लोड करने को ना. मैं बोलता हूँ उसको.
हेलो मैम
करो भाई तुम्हारा लेट करवा दिया हमने
बट अच्छा था नाइस वन वो कराना है आ गया आ गया सुन हाँ
एनीमिया मैम
वही कर रहा है वहाँ से ना अच्छा पैनलिस्ट और वो panel discussion on anemia, and I would like to call upon stage our panelists for today's panel discussion. First, I would like to call Dr. Alka Pandey, ma'am. She is Professor Narayan Medical College, Saharsa, and she is Vice President-elect Foxy 2022-24. Ma'am, please come on the stage. Dr. Alka Pandey. Next panelist, Dr. Yashodhara Pradeep. She is Vice President Foxy 2022-23, ma'am. Please come on the stage for the panel discussion on anemia. Next, can we have Dr. J.B. Sharma, Dr. J.B. Sharma sir on the stage. He is Professor AIMS, and sir has been awarded by Dr. B.C. Roy Award by Honorable President of India in 2015 for research in obs and gynae. Welcome, sir. Next, can I have Dr. Shalini Agarwal on stage? She is Principal Consultant Cloud9 Hospital, and she is presently Clinical Secretary KMOX. Now I would like to hand over the mic to Dr. Pooja.
Thank you, Dr. Monica. I would like to now welcome Dr. Smita Jain, who's a MBBS, MS in Obs and Gynae. She's a specialization assisted reproduction. She is a secretary, Mission Pink Health, IMA West Ghaziabad. Ma'am. I would next like to invite Dr. Chavi Ranjan. Ma'am is Director, Arogya Surgical and Maternity Center. Next, I would like to invite Dr. Richa Singhal.
Dr. Richa Singhal. Dr. Richa.
Ma'am is Senior Consultant in Yashoda Super Specialty Hospital and Cloud9 Hospital. Last, I would like to invite Dr. Meenakshi Sharma, ma'am, who is a consultant at Yashoda Super Specialty Hospital, and she's Secretary, East Delhi Gynae Forum.
Now I would request Dr. Yashodhara ma'am to please call upon stage our speaker for our moderator for today's panel.
Our past president, Dr. Ashish Kumar Mukhopadhyay, who is a principal and professor and unit chief of Government College, CSS College of Obstetrics, Gynae and Child Health, Kolkata. और कोलकाता में हमारी AICOG होने वाली है. Yeah, Vice President Foxy 2016 and 17, Governing Council member ICOG and past president of the Bengal OBGYN Society, ex-chairperson Medical Education Committee Foxy, and scientific chair of AICOG. पकड़ लीजिए इनको बस. WHO fellow in maternal health. So, Dr. Ashish, this is a very small introduction of Dr. Ashish. He has got many, many awards and many achievements. So I invite Dr. Ashish, please continue with this. Welcome.
Thank you, madam. Good evening, everyone. Small men need small introduction. But big problems need big discussions. Unfortunately, there is no time today. We are very short of time today because some cultural program is lined up and we cannot stand in between the cultural program and the scientific program.
No,
I know
scientific that is more important, sir.
Okay.
Sir,
Thank you so much.
on,
बस यही तो सुनना चाहते थे, madam. Thank you. Take some opinion about some burning issues in our country. And I feel very sad to say that the cheapest ore in our country is creating the costliest problem. And if you go for the NFHS data 5, last data, the incidence of anemia, prevalence of anemia actually has increased. After doing so many attempts at controlling the anemia, both in non-pregnant as well as pregnant conditions, actually what has happened, the prevalence of anemia in pregnancy which was there in NFHS 4 has increased to 59%, which is a pathetic situation to say the least. And most of them, all of you know, is because of the iron deficiency anemia, or rather nutritional deficiency anemia. We are such shameless people that we do not consider this as a national problem and we do not go on our footing. So I feel sad for that. I don't know the feelings of you. I'm expressing my feelings of grief and concern at this pathetic situation of our women. And we talk big. So it's a global part and everyone knows that WHO has declared it as a global priority long ago. Public health significance is severe. And look at this prevalence which I was talking about. And look at the graph of iron deficiency in our country. Pregnant women aged 15 to 49 years, this is NFHS 4 data, 57.9 total. And in NFHS 5, it has increased to 59%. It's really very sad. More than 50% pregnant women. The data of December 2018, that's the National Iron Plus Initiative. I think there was some discussion on this for anemia control program. January 2020, when the COVID was on, 62% of pregnant women had anemia. 5% were severely anemic. The data from Kanchipuram, Tamil Nadu, one state which showed good result before the COVID. 26 March 2020, 46% females, 33.5% of pregnant females were found to be anemic. So during the COVID period also there was no respite. Well, the panelists must agree on these definitions because we are a developing nation and we cannot have the luxury of the CDC definition having 10.5 hemoglobin percent. Professor J.V. Sharma, you were one of the luminaries. What did you like to say about the WHO acceptance of 11 gram percent hemoglobin? I would like to hear from you.
Okay. Yeah, I sir totally agree that there have been some difference in ICMR definition and WHO, but I think let's standardize to one thing only, the one which we use at AIMS, like, you know, I mean, or in India, 11 gram, it should be more than 11 for normal, 10 to 11 is mild, 7 to 9, I mean, 10 is moderate, less than 7 is severe, and less than 4 is decompensated or very severe. I was talking to sir before, when I was a medical student and like PG, I have seen 2 gram, 3 gram in Rohtak, and they were walking. I was shocked to see that. So that luckily we don't see these days. So let's keep it, but anything less than 7 is a high risk of mortality of the mother, and less than 4 decompensated is very, very high mortality. So luckily that has decreased. But as sir has said, incidence has gone up. Luckily that is for mild to moderate anemia, which are not that dangerous. But I totally agree with you, sir.
सर वन पॉइंट आई वुड लाइक टू से वी एज गायनेकोलॉजिस्ट हम ना 10 और 11 को भी सोचते हैं कि ठीक है ये परसेप्शन पहले चेंज करना चाहिए 12 से कम एक्सेप्टेबल नहीं है पहले हमें अपनी नजरों में अपने ही परसेप्शन में ये चेंज करना चाहिए 11 को हम बोलते हैं कि ठीक है व्हाई एट 11
किसी को राइस नसीब नहीं होता किसी को पुलाव चाहिए
व्हाई शुड इंडियन कैन यू गो बैक टू द प्रीवियस स्लाइड व्हाई शुड इंडियन women be considered to have normal hemoglobin at 11 gram percent.
That's a WHO recommendation, madam. Let us not say this.
Yes.
Let us not discuss on this. It's not the right platform.
Yeah.
But at least 11 gram percent, if the WHO has recommended.
We shouldn't think 10 10.5 से तो चलो ठीक है. That is an aspect which needs to really change over here.
Madam, WHO is concerned with developing nations. Rather, we should respect WHO's wishes, and they come to it after a lot of consultation with cross-country consultations. So that is why we pay respect to the WHO recommendations. I know 12, 13, 14 there is no sky is the limit. 12 by 12 सुनने में बहुत अच्छा लगता है. But 11 gram percent standard पे जो an incidence of anemia है, that is also very high, no? So let us not discuss on these issues. The important point is many people do not remember that iron requirement in pregnancy is it's not squarely distributed. Total iron requirement is how much, madam? Total iron requirement during pregnancy? 1000 milligram.
It's 1000 milligram.
But this is not squarely distributed. If you look at this, the distribution requirement is very high in the late second trimester and third trimester. If you require only 1 to 2 milligram elemental iron per day here, you require 6 to 7 milligram elemental iron per day here. And if you talk about the absorption of iron, dietary iron, the absorption is 10%. Isn't it? Roughly 10%. Yeah.
Even less.
And in anemic condition, it is higher. But the problem is that the more the pregnancy advances, the patient's diet takes an important part. What is the problem with Indian diet? Can I start with you, madam? Yes.
Indian diet has a lot of phytates and oxalates, which hampers the absorption of iron. And people in India have a habit of taking curd along with the meals. So which further decreases the iron absorption which is available in the diet. And Indian diet as such is poor in iron. This more of vegetarian diets are very poor in iron.
Madam, let us not blame vegetarian diet. See, the most important point is we are very big rice eaters. We are cereal consumers. We love cereals, both on the plate as well as on the TV. We love cereals. And that is the reason why we get glued to the glutens, the phosphates, the phytates, which cause insoluble iron chelates, which are of no use to us. And naturally, what happens? The iron is not absorbed properly. To top of that,
I just want to add that you must be remembering that in our houses, all our grandmothers used to use the green vegetables, only the leaves, not the dantal, because it is having a phytate. And
Correct.
the green leaf is having your calcium and this thing. Like methi is rich of calcium, but palak is rich of iron. So you have to educate your women that when you are talking about the green vegetable, you should not take the dantal over
Agreed,
it.
madam. But what do you educate about
are
the
very-
rice? Rice is the staple food, where you cannot say that this rice is not having phytates, this gund of rice is not having phytates. You cannot have that. And 1 minute, madam, coming to that tea and coffee. I know you love tea. See, the east coast of India is full of rice eater people. And we have found that 45 to 50% of the anemic women, they live along the banks of the river Ganges. So these are the facts that we need to, you cannot change their diet overnight. Right. You cannot ask them to have, the protein and the, like the Americans' diet. We cannot advise them.
Right.
You have to find the solution to that. And that is the reason perhaps WHO, madam, once again I am coming to WHO, has recommended that all the iron deficient nations, India is a proud member of that, less more than equal to 40% jinka incidence hai, they must have the iron supplementation during pregnancy and after delivery. That's the reason. And we must avoid that. And how many doctors know about the proper prescription of iron? I just want to have your opinions. You are talking about tea. Yes, tea and coffee are extremely popular in India. It is a part of social life. Whenever somebody comes to the house, the same pregnant woman will make the tea. Isn't it? Now, tea and coffee reduce up to 20% of iron absorption. Why I am talking about doctors, madam, they have the tea and coffee rarely these days. Nowadays, they are not called at home, so they don't have tea and coffee, which is cooked by that lady. But many doctors I have seen prescribing iron after food. What happens after food? Madam, you said that? You said that. Okay, that's very good. About the phosphates, tannin, these are all retardants of iron absorption. Another one point. You must have noticed, madam, you are very senior. I'm happy to see Dr. Sharda Jain. She's so senior and so accomplished a clinician. Many people, many doctors prescribe iron and calcium together. Calcium reduces iron absorption by 20%. So these are the small little facts which I want to propagate for the doctors. In the CME, we should propagate all these facts,
One of the other point in diet which I wanted to mention, I think it starts from the childhood. One of the fascinations, especially in North India, is with milk. Milk is the most iron deficient food that ever is in our diet. The one thing which is not having iron is milk. And the child, especially it starts from childhood. The child when it's born and when they are weaned off, the first thing when a child gets up in the morning and it is given is a bottle of milk. Doodh lo or Parle Ji. The biggest Parle Ji which has nothing but maida and butter and milk, where there is no iron at all. And that is where this vicious cycle I feel starts off from, the fascination with milk.
So the problems, what I'm trying to highlight, we have created them. And it has propagated in a cyclical manner, in all the households in society, be it rural, be it urban, everywhere it has been cyclically propagated. Next, come to the next part. Madam, time is limited. Our diagnosis of iron deficiency anemia. You tell us, how do you diagnose? I will start from Dr. Alka Pandey. Starting from clinical diagnosis up to lab.
Yes, first we will do a CBC examination, peripheral smear, then MCV, MCH, MCHC, and RDW.
Madam, whenever we ask our students, you only advise that you start with the history and physical examination.
Yes.
So why not here?
You said investigations.
No, I said how to diagnose. I didn't say investigation. Anyhow, the history is extremely important. Clinical examination is extremely important. And I think that all of us know that. Let us skip that discussion, because this is a disease of science, not a disease actually, disease condition, but there is no symptom, hardly any symptom. To the later phase, when the anemia is too severe, then only she gets breathlessness, then only she gets SOB, difficulty in working, etc., etc. Yes, now come to the laboratory. CBC is extremely important. How many of us use CBC as a diagnostic test for anemia? I want to know. Yes, sir.
Sir, we use it, but I feel that just if I ask the PG undergraduates also, if you had to, given only 50 rupees, you have to do the test. So just hemoglobin and peripheral blood film. These are the two simple and easily available in every hospital, maybe free of cost. So I mean, hemoglobin will tell us the severity of anemia, patient is anemic, and the peripheral blood film will tell us about type of anemia, microcytic, hypochromic, megaloblastic, and it can also show us malaria parasite, it can show us even LD bodies, it can show us even cystocytes or even hemolytic anemia, like, you know. So it's a very, and sickle cell, and sometimes even malignant cell. So like so simple investigation can give you so many investigation. For the test, I mean, we don't have to do in every single patient, but ferritin, if available, can tell us about iron stores also. But other TIBC, you know, protoporphyrin,
Most
they are not
important,
required.
I think, in CBC is MCV, MCH, and MCHC.
Okay.
I think these three are.
I will take the opinion of all the panelists. Madam, anybody else differing from whatever has been said?
Yeah, you read the RBC count as well.
Okay. So up to now, what we have got, hemoglobin percent, PCV, MCV, MCH, MCHC, we have got peripheral blood smear, isn't it?
RDW.
Yes.
RDW, which
I
is
think, madam, I will put maximum importance to this called RDW. Now, if you talk to the hematologists, they say that the gynecologists are very poor prescriber of CBC. They are very scared to write CBC. I don't know why. It takes the same time. Today the machines are available. CBC report will come out in 15 minutes time. And you get a wealth of information from the CBC. And the most important information to me, as far as I have understood from a hematological point of view, is RDW, sir. If the RDW is 18, 19, and you have a microcytosis, you have MCH low and MCHC low, certainly can stamp a diagnosis of iron deficiency, and even no need to go for hemoglobin electrophoresis even. This is not my statement. This is the statement from the hematologist. They are saying. Of course, if you to the patient who can afford it, you can go for HPLC. There is no problem about that. And that too when you are working in an endemic area for thalassemia. But all patients, I don't think that will be necessary. And coming to ferritin, yes, ferritin is a major issue. I know it's the most important diagnostic point of iron deficiency anemia. But remember, ferritin is an acute phase reactant. It is an inflammatory product. So whenever you have a little bit of cold and cough, the ferritin level goes high. You have to interpret your result with too much of caution. So better, I think, you depend on hemoglobin percent, all right. This hematological indices are all right, low MCV, MCH, MCH is okay, but please read the RDW. It's extremely useful, and this is not my statement, this is the hematologist statement. And I think that today, previously what CBC used to be a painful job, you know. If you have to do a CBC, it would have taken almost 6 hours time. But today the machines have come which do the test in 15 minutes time. And it is as expensive as your hemoglobin, sir. Today the machines are such that, so everybody say that he would do CBC and look for RDW. Okay?
Yeah. And because I agree, sir, in North India, this I mean, thalassemia minor is very common.
Very common,
especially
yes,
in
yes.
Punjabi community.
Very
And
common,
their
North
hemoglobin
India.
never goes more than 9 to 9.5, including in our, I got some couple of residents, MBBS doctors, 9.5.
I know. But why? Okay. Madam, it's a privilege for us to felicitate you. We can stop the panel anytime. No, please
Ma'am,
come. Aye, madam, aye.
Sir, on top. So we stop. Sorry for interrupting the panel, but I would like to invite Dr. Sharda Jain ma'am, one of the most senior-most gynecologists, teacher of teachers, and we'd like to invite her and felicitate her with the Luminary Award. I would like to request all of you, if you could give a standing ovation to ma'am, please. Thank you so much. Absolutely, it's such a matter of respect for, it's a pleasure for all of us that ma'am has joined this session, and she's been a part of it, and she has spent a valuable time with us. And definitely, ma'am, we are so grateful to you that you have joined us today and totally deserve this Luminary Award which Sir has instituted. And this is for all the luminaries of Foxy, and especially for today's day, we would like to obviously hand over this over to you. Thank you so much, ma'am, for being here.
This is a luminary award and only given to the topmost people in the Foxy. I have given it to very few, and I consider us as one of the topmost people in our federation.
My special thanks to Dr. Pai and her team for giving me this particular award. But I appreciate Dr. Pai not only from 1992. At that particular time, he asked me, Dr. Jain, I want to make you IVF expert. I did not listen to his advice. But then I realized that in the meetings or in the conferences, I used to shy away attending IVF rooms. But that challenge I took. My request to him is that he should see to it, जो ये बदलाव की बात करते हैं, इस बदलाव का सचमुच बदलाव आना चाहिए. And I appreciate your information equally to everything and technology. I think you just get stuck to two things: anemia and cancer cervix, Mukt Bharat. And my request to you as an IVF expert is that it's very shameful that all gynecologists feel that they are IVF expert, but they are not. They're harming more because they're not trained into infertility in IVF. You should bring out every year, whether you are the president or not the president, evidence-based practices, and you should see to it that it goes to each and every gynecologist. So at least they practice that particular thing. So I think, that's my request to you. And I'm sure with your kind of power and things like that, you can definitely do that. So I think remain focused on these two areas. And the government, not only the government, the people of this particular country will bless you always because they remember what you do. So I'm very thankful to you that you brought a change. At least badlao ki baat to karna chahiye. You are thinking about, the thinking of the gynecologists have to change. The attitude of the doctors have to change. And they have to give back to the society. Because 4 crores of rupees the government has spent on us, and that we should never forget till our last day. Thank you very much.
Madam. I think we'll take your advice and we'll focus on only anemia and CH cervix.
And IVF also.
And IVF. IVF तो default से हम करेंगे.
वो तो जरूरी है. This is such a secret area, people don't share that with them. But I think they must at least have the book. This is what evidence-based Dr. Pai has given, and this you can.
ये करेंगे. Priyankur.
Thank you so much.
Yeah.
Thank you. Thank you so much. It was my pleasure.
I apologize to all the faculty here. It is a disrespect to any faculty,
नहीं हम लोग
No.
family है.
Ma'am already, yeah. Thank you so much, ma'am. And again, as ma'am has said, we are sorry for the break, but I think this was a worthwhile break, and we can call it a Kit Kat break, a luminary break, where we felicitated ma'am. Over to sir again.
Okay. So, would you like to continue or go to dance? Okay. So, we have now understood that the iron tests, so-called iron tests, are full of fallacies. That is why we have stopped prescribing to them. Look at this case. A just 17-year-old girl was complaining of fatigue, weakness, shortness of breath with minimal activity. Her menstrual cycle was regular, heavy flow, passage of clots. She had brittle nails, excessive hair fall. She is 5 feet 2 inches, 40 kg, skin pale, conjunctiva pale. Pulse and blood pressure so-called normal, thyroid, breasts are normal, no lymphadenopathy. Parabdomen soft, chest, CVS, NAD, and she's a strict vegetarian. Okay. What is your diagnosis, madam? Provisional diagnosis.
anemia due to excessive
Okay,
blood
then
loss
anybody will
and
do
inadequate
this
diet.
anemia diagnosis.
Puberty menorrhagia causing anemia.
Yeah.
And with nutrition.
So now how do you evaluate this patient? Sir, आपसे शुरू करेंगे.
हाँ. Yeah, sir. Most probably that was we call it AUP these days. So, but I mean puberty menorrhagia causing anemia, which is partly because of blood loss, partly because of nutrition, and must be iron deficiency because of that.
Okay.
We see in fact 5 to 6 gram also in these girls.
So these are the investigations that we have suggested. Can I have a look at them and suggest if you want to add something or deduct something?
Yeah, sir. Actually, like in 17-year-old girl in puberty menorrhagia, especially at AIMS, we also try to do some hematological investigation, especially bleeding and coagulation profile. Some of the girls may be having bleeding and coagulopathies and all, especially if they are severely
Yeah,
anemic.
it has been said that in puberty menorrhagia, roughly 40 to 50% cases are associated with coagulation disorders. You're very true. Your point is well taken. These are the reports that we have collected from the patient. Her hemoglobin was 8.8 grams per deciliter. Pata nahi kyun? Most of the doctors are always interested only at the hemoglobin level. Doctor, can you explain why this happens? Whereas we know very well when we have to give lectures, we say loud and clearly that hemoglobin is a late manifestation of anemia.
Absolutely.
And
Pick
a
up
girl
ice.
should be caught hold of, catch them young when she is having iron deficient state. Because the storage iron is deficient at that point in time. But in practice, everybody, if you ask them, how are you? What is your hemoglobin like? Everybody is worried about the hemoglobin level. Remember, hemoglobin or the erythroid anemia is basically the last feature of anemic condition, and when actually everything is gone now. So you need to catch hold of the lady or a girl when she is about to develop anemia or before development of anemia, and that is why nutritional counseling, a good diet, a good lifestyle, avoiding junk food, etc., so very important. So that's what I want to say, that in our situation, you always prefer the hemoglobin person. Now the classification.
So
Yes, ma'am.
how do we catch this person before the hemoglobin has become less in a routine investigation without doing iron levels? Because iron levels and all are expensive.
No need.
Doing ferritin is expensive. I can't advise everybody to be getting their iron levels and ferritin done. Is there any other way in which picking up that yes, the stores are going down?
I'll tell you,
is there
madam.
any way to do that?
I'll just tell you, madam. This is a very important question that she has raised. It's a very important issue from a growing child, growing girl. How do you catch hold of anemia? Now, mothers love children. All mothers love children. It is their right. But then they ignore that there are small things, little things. Like when the parent-teacher meeting happens and the teacher says, your daughter has started losing this thing, balance, attention, not balance, attention. She is having attention deficit. And then mother goes back home, talks to the girl's father and starts shouting at the girl. So that is a point of time when you will not get the gross features like stunted growth, brittle nails and all those things. Those are found only in Hindi movies. But in reality, when you do not see that your child is not concentrating on studies, she is not being able to study properly, she is always trying to sleep. She is not having something very properly what you used to have. Those are the points of attention where you should, I think you can easily catch them. Because you know very well at around the age of 11, 12 years the menstruation will come. And you also know that first 2 years will be severe bleeding. You can always expect this, rather not expect, anticipate these things. But unfortunately we do not do that. Another point, madam. When a girl grows up, when she grows up in width, mother is very happy. My daughter is becoming healthy. Actually it's the opposite. Probably the beginning of polycystic ovary syndrome has started. Pronounced adrenarche, box-like structure of the girl. Nobody pays attention to all this. Awareness and all these things is very much necessary. Thank you, madam, for raising this good point. Now, these are things we cannot discuss now. ICMR anemia severity classification, all of us know this. So I will skip that discussion. Moderate, severe, everyone knows that. The important thing is how to treat the patient with anemia. Now this girl, how do you propose to treat her, sir?
Yeah, so basically there are two factors in this girl. One is anemia and second is her heavy menstrual blood loss. So I'll treat both of them. And as you were asking, sir, no, the features, madam, early, one of the important features, no, iron is part of peroxidase enzyme, cytochrome and other. So the girl will feel very, she will feel a bit sleepy, she will feel a bit lethargic and all. So, I mean, normally these girls should be very active and alert. But if she is very lazy, and everyone says she is very lazy, especially I keep hearing the mother-in-law and, you know, sister-in-law, my bhabhi is very lazy, so all the time she is sleepy. As a mother-in-law also saying. So the reason is that because she has got low iron stores.
Sir, that
So
young
she
girl
not
has
trying
come to you with her mother.
Yeah.
Now, how will you propose to treat her?
Treatment is in this case, like I'll start simple tranexamic acid, memnamic acid to her. Okay, but of course I'll like to rule out some other cause also for that date. Plus I'll start her iron tablets, a simple ferrous sulfate, ferrous fumarate, gluconate, whatever is available in the government hospital or private. So single 100 because she is at treatment. So I'll give her minimum 100 milligram twice a day elemental iron, twice a day. Now she therapeutic regimen, and that will take care of that. But if she is not responding to that, these patients for abnormal bleeding, they may require little bit more than that, like hormonal therapy, norethistron or something can also be given depending on the cause. And maybe a simple ultrasound pelvis is useful because we may have to rule out some other cause also for these patients. So this is how I treat in my practice. But beyond that, if I find like some patient coagulopathy, and I had a girl of puberty, Bernard-Soulier syndrome, another girl with von Willebrand disease, etc. They have to be treated in their own way. That is beyond the scope of this lecture today.
Okay, so
I just want
exclude kidney disease.
I just want to add that for that, whenever these patients are coming, you have to do a basic CBC, because once you started, or the hemoglobin, if it is a population based.
No, it's already done. It's already done. Report I have shown you.
Yeah, I know. So I just want to give a message that you should have a basic investigation before you start. So you know whether that girl is responding to treatment or not. After 3 weeks or 4 weeks, you repeat ultrasound. If she does not respond to it, that means there's something wrong. So you ask for the compliance by asking simple thing, what is the color of your stool? What is the color? If she is saying that it's a black stool, you know that she is taking iron. You have prescribed, but whether she is taking or not, you have to make it sure. That is what I just want to add, that compliance is also being checked at each end. Deworming is very important. That's a Government of India guidelines that you have to give iron, albendazole, and then repeat the hemoglobin after 4 weeks. If it does not respond, you have to then think of, then you do a iron studies and all those things.
One more thing, for how long? At least 3 months, and once the hemoglobin is like up to 12, even to build up the stores also. So
yeah, of course.
For how long it should be continued, that is very important, because हम ज़्यादातर 30 गोलियां लिख के भेज देते हैं, वो prescription में नहीं होना चाहिए.
When you reach to the desired hemoglobin, you have to continue for 3 more months.
So I take your point, sir. You have started 2 tablets of iron per day because the condition, thinking that the iron is very severe and deficiency anemia is very severe. But I have an apprehension. If you start twice daily iron from the very beginning, she will throw it up. And probably the rest of the life she will not have iron, because she is very apprehensive of iron now. And when the mother asks the daughter, have you had iron? Yes, ma, I'll have. She's actually thrown it out of the window. Bhar mein jai iron. I cannot have this.
Which is the reason why we give iron after.
Yes. No, not before food. There's a solution for everything, madam. I'll come to that. But before that, I just want to tell you that iron is an element, is a very simple element, but very complex in its side effects. Iron is absorbed from the duodenum and upper jejunum, isn't it? So what happens when you prescribe a sustained release iron preparation? What happens? Is iron absorbed from the rectum? Then why do you prescribe the sustained release preparations? Number 1 question. Number 2, madam told me about the empty stomach and full stomach. The best time to have iron is 11 o'clock in the morning. That is between breakfast and lunch. Those who are working women can take the iron tablets with them in the purse. No problem about that. And have the iron only with fruit juice, not with tea, coffee, not with any other drink, not with water also. Okay. Now, can someone tell us, sir, do you depend on Menzer index in differentiating iron deficiency anemia from thalassemia these days, or you have better taste? Do you think? So Menzer index, anybody doing these days?
Then we do
Are you doing
HPLC.
Menzer index? This one. This is for diagnosis or differentiation between thalassemia and iron deficiency anemia. Are you doing that? Plus नहीं, आप यही बोलो पहले.
First we do this, sir,
हाँ.
and if we suspect, then we do hemoglobin lactopurus HPLC for the.
Okay. So there are 3 tests that we can do. Number 1 is, as I said, CBC. You can believe on the narrow this thing, RDW, which actually suggests that thalassemia or hemoglobinopathies. Second is this Menzer index, and third is confirmatory this hemoglobin
So
leukoprotein.
can I make a small comment here? Even if we are not calculating the Menzer index, there is a very small and simple thing. If you just look very closely at your CBC, you look at the RBC count. The MCV, MCH, MCHC is low. It's low in both thalassemia and in iron deficiency.
That we have already discussed,
but
madam.
But if the RBC count is on the higher side or it's high, it is thalassemia.
We have already discussed
and if
them.
it is
I was just going to ask you only about this Menzer index,
Yes.
that's all.
So Menzer index, these values come because of the RBC count itself. Because in thalassemia, the RBC count is high, so Menzer index is less than 13.
There's a ratio here.
Yes.
Okay.
And because RBC count is...
Okay, this was mentioned just to show that it is not very useful these days. We do not use anymore. That's why I wanted to say. Acha. So now the preventive measures, we all know about the preventive measures. Hookworm infestation is very common in rural areas. So you need to teach them, educate them. Control of malaria is which is endemic.
That. In fact, all my mates coming to my house, first thing I give them, not only albendazole, I give them Bendi Plus,
Okay.
which is ivermectin plus albendazole. So I say this is Ramban with Paramastar. No, one will kill all ectoparasite, other will kill all endoparasite. And even to whole family also sometimes we give. So because this lice manifestation also, they also suck blood. So that also is the cause. So just
So these are the preventive measures. Everybody will agree on this. Okay. So I am skipping this. And this is the nutritional advice, diet advising. Tea drinking should be separated from meal time. It's very, very important. We cannot leave tea, but you have to separate the timing of the tea having. So
sir, many times we just tell the patient, जैसे उसकी mother don't eat this in pregnancy, don't eat this pregnancy. So one of our doctors, he said, खाओ खूब खाओ, जो भी मिले वही खाओ.
So this,
otherwise
right. There's another dietary problem which is very common in India, and that is भुनोफाई. दो साग बनाते तो वो जब तक 1 घंटे तक भुनेगा नहीं कढ़ाई के अंदर, तब तक उसमें स्वाद ही नहीं आएगा. And what you are having is basically just iron is very good, but even in iron अगर आप उसको भूनते रहोगे 1 घंटे तक तो उसमें से बचेगा क्या? Nothing is going to remain. So that is an important point to tell them कि as less cooked, blanched food, that is what
let
is
us stop
important.
bhunoing.
लोहे की कढ़ाई.
Let's stop that bhunoing business.
Okay. Thank you so much. Now I come to the last part of the discussion.
Add lemon into it.
Madam,
Whenever you are cooking all
कह रहे कि बंद करो अभी
lemon
नाचना है नाचना है
lemon
गाना है I just
all
2 or 3
fat
points
has
and say finished.
Yes.
हाँ.
हाँ, आप जितने साग बनाते हैं सब में खटाई या लेमन आप जरूर डालें, उससे उसका एब्जॉर्प्शन बढ़ेगा.
Okay.
Yes.
कितना इंटेंस डिस्कशन हो रहा है
Ascorbic
देखो.
acid is the most important thing.
अच्छा अब बताओ कि जब अब हमने तो डिसाइड कर लिया कि टाइमिंग क्या होगा. Okay. Split this thing, tea and coffee, and give at 11 o'clock. That I have understood. Okay. But tell me the indications of last part we are coming now. Intravenous iron administration. What are the indications?
First is if patient is intolerant to iron preparation, she has malabsorption. Despite giving iron, there is no improvement in the hemoglobin levels. Third is inflammatory bowel diseases.
Okay.
Fourth is she is near term and we don't have much time. So for that reason, parenteral iron is
Who doesn't have much time? You are the patient. Okay.
She's about to deliver in a few weeks and there's not much of time. Then you give IV iron. So these are the main, and chronic renal disease.
Okay.
There.
So iron, this parenteral iron transfusion or infusion, but it's not transfusion, it's infusion, it is no longer it's not a first line therapy. It is always an indication based therapy. We have to remember that. Okay. And dose calculation, all of you know, and the differences between oral and parenteral iron also you know. Indications for blood transfusion. I think this is more or less crystallized these days according to the Government of India regulations and Government of India recommendation. I'll come to that in a minute. And the clinical indications are, everybody knows, active bleeding, hemodynamically unstable, critical anemia, hemoglobin less than 7 gram%, acute myocardial infarction, very careful, failure to respond to other treatments. So these are the...
I just wanted to ask this, hemoglobin less than 7 and patient is all stable. She is like chronically anemically probably. So there also would you give
Good question.
Less than 7
I
near
don't think
term.
so.
Near
I
term.
don't think so.
Near term.
No, non-pregnant even.
Very good question.
Yeah.
I must say it's a very good question. See, as much as I have understood about the blood transfusion is the only treatment which will relieve the tissue hypoxia and anoxia. No iron in the world or no hematinic in the world or no nutritional element will correct that. You as a doctor, gynecologist, you know what are the conditions where tissue hypoxia is there or anoxia is there. Treat with blood only when it is necessary. That is tissue hypoxia is there. A lady with 5 gram, 7 gram% hemoglobin can walk around easily in the ward. I have seen, Sarah has also seen, patients with 2-3 gram% hemoglobin. What the current recommendation is, do not unnecessarily transfuse blood in these women. You can go for injectable iron, you can go for starter oral iron also if you have time, but then do not go for blood transfusion. So that is the last message. Do not go for blood transfusion. Dr. Rishikesh Pai is also saying that, so I have to close it here. सर से पूछो सर आपसे विटामिन B12 डेफिशिएंसी पूछता बोलते हैं आपको बोलना पड़ेगा विटामिन B12 डेफिशिएंसी नहीं बस 5 minutes में I'll close. B12 is very common. Very good message, madam. Thank you very much. Effect of anemia and pregnancy and mother. Just one point I'd like to discuss now, that iron deficiency, we were very scared up to all these days because it causes maternal complications, fetal problems, preterm labor, PROM, PPROM, etc., and in the fetus, early neonatal death, stillbirth, etc., abortion. But the point is that most important research material that have come up, which says that it does not spare the next generation. It delays the growth and development of the child. It delays the mental health of the child. The poor performance at school, the baby doesn't grow up properly.
Absolutely, sir.
So these things are more important. So if not for the mother, at least prescribe iron for the next generation. It's extremely important. And the list of complications are...
If you want your child to grow and become astrophysicist, cardiac surgeon or male gynecologist like that, then give iron to the mother.
This is the last slide of the day today. This is the indications for blood transfusion in pregnancy, which is clearly written, is also supported by Foxy GCPR. Antepartum period, pregnancy less than 34 weeks, hemoglobin less than 5 gram% or 5 to 7 gram% in presence of impending heart failure. If it is more than 34 weeks, madam, are you concentrating on this? Madam, this is a very important slide, yes. Hemoglobin less than 7 gram% even without signs of cardiac failure or hypoxia. Severe anemia with decompensation, anemia not due to hematinic deficiency like hemoglobinopathy. Hematologist should always be consulted. Acute hemorrhage, always blood transfusion indicated right from the time of Netaji. We always said blood, give me blood, I'll give you blood. Intrapartum period, hemoglobin less than 7 gram% and postpartum period. So I think this is a very useful slide available by Government of India guidelines. I think we should abide by
But
this.
give blood with caution in pregnancy. Sometimes patient go in labor just after blood transfusion. So that also you have to
And this is the enterprising movement that the Government of India has undertaken. That's Anemia Mukt Bharat. All of you know this. So I am closing the presentation here. And thank you very much for your participation and a very good and interactive panel. And thank the audience for keeping with us up to this time. Thank you so much, all the panelists.
Dr. Ashish,
Thank
with
you,
your
our
permission-
panelist and moderator,
with
Dr.
your
Ashish
permission,
sir,
I
for the
just want to
wonderful
make
discussion.
One comment, if you permit me. Dimorphic anemia is more common. You should not see for the megaloblastic anemia, because it is, you should see if
She
your
has mentioned them.
hemoglobin is less, it says normocytic normochromic, which cannot be. That means it is a megaloblastic dimorphic anemia. So you must correlate each and every investigation report with each other. Otherwise you will not. You will see many times it is hemorrhage you can see. Otherwise you will not see iron deficiency with a normocytic normochromic. If it is there,
Thank you,
it
madam,
is a
for those inputs.
Yes.
And perhaps we are standing in between the dance performance
Thank you.
and the academics, which is not desirable.
Yes.
Thank you so much.
Thank you. And before we finish this session, I would like to request Dr. Rishikesh Pai sir, President
Yes, sir.
Foxy, and Dr. Somna Goel ma'am, President of the Khora.
Dr. Archana Verma, I think she has left. Dr. Ritu Jain, she's a senior consultant from Ghaziabad, and since past 27 years she is practicing, and she is the current president of GOX. She is an active member of GOX and IMA Ghaziabad. Dr. Sushma Dikit, ma'am is also not available. Dr. Deepa, she is senior consultant of Yashoda Super Speciality Hospital, Kaushambi. Ma'am is having vast years of experience, and she is having lot of membership and fellowships and awards also. Dr. Seema Vashne, she is the Secretary West UP Chapter ISOPAP, Chairperson GOX 2021-22, past President GOX, and she has received Wonder Woman Foxian Award and lot of other awards including sports. Dr. Reema Agarwal, she is endoscopic surgeon and infertility specialist practicing in Indrapuram from last 20 years, and her area of interest are high risk pregnancy, infertility, laparoscopy. She is a joint regular KMOX. Now I request Dr. Deepa ma'am to please introduce Dr. Alka Pandey ma'am so that.
Alka Pandey ma'am, and to invite her. She is Professor Narayan Medical College, Saharsa. Welcome, Dr. Alka Pandey ma'am.
Good evening, everyone. And I thank the organizers for giving me this opportunity. So
I request Dr. Archana Sharma ma'am, please also come on the dais and sit.
So I have to talk on evidence-based cesarean section.
Dr. Somna Goel ma'am. Ma'am, she is on the stage. Dr. Vanna Tripathi and Dr. I think everybody is on stage who is for the last session. No ma'am, actually last session नहीं हो रहा तो उनके भी.
Section delivery is one of the most commonly performed surgical procedures worldwide, and it should be standardized. Why? Because standardization within institutions improves safety, efficiency, and effectiveness in healthcare delivery. Surgical training among obstetrics and gynecology residents would become more consistent across hospitals and regions, and proficiency in performing cesarean delivery will be measurable. So what should be the gestational age when you plan a cesarean section? Planned cesarean section should not routinely be carried out before 39 weeks due to RDS problems. And team-based training and simulations on emergencies during surgical cesarean section for surgical team must be practiced so that they are accustomed to doing the surgery. Then use of surgical safety checklists prior to start of cesarean section must be done. Pre-operative fasting carbohydrate load. Women should be encouraged to drink clear fluids until 2 hours before surgery. A light meal may be eaten up to 6 hours before surgery, and oral carbohydrate fluid supplementation 2 hours before cesarean section may be offered to non-diabetic women. Anesthetic choice. Women who are having a cesarean section should be offered regional anesthesia because it is safer and results in less maternal and neonatal morbidity than general anesthesia. Pre-anesthetic medications, we all must be using antacids and drugs such as H2 receptor antagonists or proton pump inhibitors to reduce gastric volumes and acidity before cesarean section to reduce the risk of aspiration pneumonitis. Women having a cesarean section should be offered antiemetics to reduce nausea and vomiting during cesarean section. And what about antibiotics? Recommend administering preoperative antibiotics within 30 to 60 minutes of cesarean section and before skin incision. When the patient is not in labor, cefazolin or clindamycin plus gentamicin should be given if there is penicillin allergy, and if the patient is in labor, cefazolin plus azithromycin should be used. Now, it is a good clinical practice for patients to bath or shower prior to surgery. Hair should either not be removed or, if necessary, should be removed only with a clipper. Preoperative skin cleansing before cesarean section with an alcohol-based solution should be performed unless contraindicated, and a reasonable choice is chlorhexidine alcohol skin preparation. So, vaginal preparation with povidone iodine solution should be considered for the reduction of post-cesarean section infections. Usually, we are not practicing this. Then, what about indwelling catheterization? When you put an indwelling catheter, especially in the setting of prolonged or obstructed labor, it is very much recommended. Women having cesarean section with regional anesthesia require an indwelling urinary catheter to prevent overdistension of the bladder because the anesthetic blocks interferes with the normal bladder function. And when do you remove it? So some authorities say that it should be removed immediately after operation, and some, the NICE says that it should be removed after 12 hours of cesarean section. Then body temperature should be maintained in the OT, and WHO suggests use of warming devices in the operating room and during the surgical procedure for patient body warming to help reduce surgical site infections. Now, everyone is practicing transverse incisions. Joel Cohen incision is recommended because it causes less febrile morbidity and takes shorter operating time. Then there is very insufficient evidence to create a bladder flap prior to making the uterine incision. Then in the uterus, transverse incision should be given in the lower uterine segment, and if the cesarean is performed for failure to progress, transverse incision should be made higher in the lower uterine segment. The hysterotomy incision is extended bluntly in the cephalad caudal direction to reduce surgical blood loss. And cord traction is recommended method for removal of the placenta instead of doing manual removal of the placenta to prevent endometritis. Closure of the hysterotomy incision should be done in 2 layers with decreased incidence of uterine rupture. Then intraperitoneal repair of the uterus at cesarean section should be undertaken because it has been shown that exteriorization of the uterus is not, does not improve operative outcomes such as hemorrhage and infection. So, what do you normally practice? Do you irrigate after doing a cesarean section? No. Routine intraperitoneal irrigation to reduce the risk of SSI is not recommended. Are you closing the peritoneum routinely? Visceral peritoneum, the parietal peritoneum, because this reduces operating time and the need for post-operative analgesia is also less and it improves patient satisfaction. So it is not being practiced, but we are doing parietal peritoneum closure. Then what about subcutaneous tissue closure? If it is more than 2 centimeters, then it is recommended that you should put subcutaneous sutures. Superficial wound range should not be used at cesarean section because they do not decrease the incidence of wound infection or wound hematoma. And skin closure should be performed using subcuticular suture rather than staples because staples have not been shown to be more effective than. Then what about use of antimicrobial coated sutures? Antimicrobial triclosan coated sutures have been found to reduce the risk of SSI. And if one has PPH, what are we going to do? Oxytocin 10 international unit is the preferred uterotonic drug followed by carbetocin for prevention of PPH in cesarean section. And the suction also works very well. Women who are having a cesarean under regional anesthesia should be offered IV ephedrine or phenylephrine and volume preloading with crystalloid or colloids to reduce the risk of hypotension during cesarean, and fluid should be limited to less than 3 liters for routine cases. Then post-operative analgesia is multimodal. That includes regular NSAIDs and paracetamol for enhanced recovery after cesarean section. So, indwelling caster should be removed immediately. Early mobilization is recommended and it should be left for 14 days in cases of prolonged labor and obstructed labor to prevent urogenital fistula. So, when do you give diet normally? Women who are recovering well after cesarean section, who do not have complications, can eat and drink when they feel hungry or thirsty. A regular diet within 2 hours post-cesarean section is recommended, and ice chips and or water within 60 minutes of admission to the post-anesthesia care unit. Regular diet ideally within 4 hours post-CS as tolerated. Tight post-operative glycemic control for diabetic women is recommended. And how do you care for the wound? remove the incisional dressing after 24 to 48 hours of cesarean section, inspect the incision and examine abdomen daily during hospitalization and prior to hospital discharge. Then WHO suggests not using any type of advanced dressing. And NICE recommends that you, after removal of the dressing, you swab it with normal saline. Prophylactic negative pressure wound therapy is used post-operatively in obese patients who have undergone cesarean section. And WHO recommends against the prolongation of surgical antibiotic prophylaxis after completion of the operation for the purpose of preventing surgical site infection. Do you practice thromboprophylaxis routinely? So it is recommended routine use of thromboprophylaxis, for example, graduated stockings, hydration, early mobilization, pneumatic compression devices to reduce the risk of venous thromboembolism for all women undergoing cesarean section, which should remain in place until the patient is fully ambulatory. And if the woman has a history of venous thromboembolism, or if she is obese, then you can add these anticoagulants. And on patient's discharge, close post-operative patient follow-up for evidence of wound complication is recommended. And you should discharge the patient with a standard written discharge instruction with post-operative precaution to facilitate discharge counseling. All women should ideally have contact with a maternal care provider within the first 3 weeks postpartum and also at 12 weeks. And to conclude, these recommendations can be incorporated into training and implemented as facility-wide cesarean section bundles. This will reduce complications as well as enhance recovery after surgery and reduce length of hospital stay. Thank you very much.
You can use the mic, please.
Hello. Thank you, madam. A wonderful presentation. Cesarean is such a common procedure. We all on day-to-day practice used to do that. And these are certain very important points to be taken care of, and the post-operative care, the early ambulation is very much important. And this gives very wonderful, good recovery.
Thank you. All the points already elaborated. Thank you very much.
Thank you so much.
Thank you, ma'am, for a very nice presentation.
We thank you, ma'am, for a wonderful session, and I thank all the panelists for chairing.
Thank you, ma'am, for the wonderful talk. We'd like to thank the chairpersons for this session. And again, I would like to invite Dr. Yashodhara Pradeep, ma'am, Vice President, Foxy, Dr. Rishikesh Pai, sir, President, Foxy, and Dr. Garima Tyagi, ma'am, Joint Secretary of the Khora Makhanpur Society, to kindly hand over mementos to our speaker and our chairpersons. Yashodhara, ma'am, you were invited as well. Please come. Thank you. Thank you for this session. So now we move on to the important session, that is felicitating the achievers and the people who does so much of important work for the betterment of womanhood. So we would like to invite Dr. Rishikesh Pai sir, Dr. Yashodhara Pradeep ma'am, Dr. Alka Pandey ma'am, and also Dr. Ashish Mukhopadhyay sir, and Dr. J.B. Sharma sir, who is also a chairperson of the Urogynecology Committee, to kindly felicitate everyone. First of all, we would like to invite Dr. Somna Goel ma'am to kindly come up and receive the Achievers Award on behalf of Foxy. It's such a pleasure and privilege that you've given us to be part of this evening with the Khoran Makhanpur OBGYN Society, and of course all the hardworking gynecologists in the society who not only work for the betterment of womanhood, but also of course to entertain all of us who have come here today. So thank you so much for that, and we would like to felicitate you with the Achievers Award. Thank you, ma'am. Next, I would like to invite Dr. Ritu Arya to kindly come up to the dais and collect your Achievers Award. Thank you, ma'am. Okay, sure. Next, I would like to invite Dr. Gunjan Gupta to kindly come up to the dais to receive your award, please. Thank you, ma'am. Thank you so much. We would next like to invite another great personality, Dr. R.S. Sharma, who has been with us through this entire evening, has waited patiently with us and given his inputs. Sir, kindly come up, and we would like to honor you with the Achievers Award, please.
Lot to him. Yeah. So he has been very helpful, and even to private practice. Normally they think only to government hospitals. Sir helped, even like Sanjay Gupta and all gave projects to everyone and taught us how to write for project protocols also. So we really thank you, sir.
Thank you very much for giving me this honor. And I take this opportunity to give some comments and suggestions, because because Dr. Pai knows me, when I initiated the working on the ART bill and surrogacy bill in 1999, when most of the people I think would have not even started the practice of IVF. And I think Professor Sarda rightly mentioned about that services provided by so many IVF specialists is not up to the mark, which I highlighted during our ICMR committee meeting also. And I try my best to put in the rules, but unfortunately, when the bill is passed, there are so many lacunas that left. And I'll see, rather I will request the President, Dr. Pai, to raise these issues at appropriate platforms so that at least in regulations it can be corrected. And in that, wherever you feel my help, I will be always available to help, because these two bills were very close to my heart. I spent almost more than 20 years to bring these two bills in to the people. And thanks, but certainly there are some issues which has left out. So please take care of that.
Thank you, sir. Thanks for your help, and we'll always take your help for everything. Yeah.
Thank you.
Secretary of ISSRF also, Indian Study of Study in Reproductive and Reproduction.
Thank you so much, sir. Such a pleasure to have you with us, sir. Thank you so much. Next, I would like to invite Dr. Garima Tyagi ma'am to kindly receive the Achievers Award. Thank you so much, ma'am. Next, I would like to invite Dr. Vinita Rustagi ma'am to kindly come up to the dais and receive the Achievers Award. We are so privileged to have you with us, ma'am, today. We request you to kindly come up. Thank you so much. Thank you, ma'am. Thank you so much. Such a pleasure. We would next like to invite Dr. Ritu Jain ma'am to kindly come up to the dais and receive the Achievers Award, please. Thank you so much, ma'am. She's coming, sir. Please come. Careful. Please come. Thank you, Ritu ma'am. Thank you so much. Next, we would like to invite Dr. Manisha to kindly come up to the dais to receive the Achievers Award, please. Not there? Okay. No. Dr. Ritu can... I think she wants to. Manisha is very popular. There are 2 people receiving the award on her behalf. A round of applause, please. Please, please. We also wanted to felicitate Dr. Archana Verma, but ma'am had to leave, unfortunately, for emergency. All the achievers for their excellent work done, and we would like to, we feel privileged to felicitate you today. Next, we would like to give away the appreciation awards to all of you for doing the wonderful work. First of all, we would like to invite Dr. Deepa to the dais to kindly receive your appreciation award. कोई नहीं सच्चा. Thank you. Invite Dr. Rima to kindly come up to the dais, please. Thank you, Dr. Rima. Next, we'd like to invite Dr. Shalini Agarwal, ma'am. If we can request you to kindly come up to the dais, please. Dr. Rima. Next, we would like to invite Dr. Smita Jain to come up to the dais. We would like to felicitate you with the Appreciation Award. Dr. Smita with us. Sir, we would like you to... Next, we would like to invite Dr. Monica Agarwal to come up to the dais, please. Sounds like Ashish sir is going into the singing mood. Monica. Next, we would like to invite Dr. Vandana Jain to come to the dais, please. Congratulations, ma'am. Next, we would like to invite Dr. Anita to kindly come up to the dais for an award, please. Congratulations, ma'am. Next, we would like to... Oh, I'm so sorry. Thank you, Dr. Pooja. Congratulations. Next, we would like to invite Dr. Annika ma'am to kindly come up to the dais and receive the award. Appreciation Award. For Dr. Chavi Ranjan, we would like to invite you kindly to come to the dais and receive this award, ma'am. Chavi, congratulations and welcome. Okay, so now for the hardworking Dr. Neera for coordinating today's session, we would like to felicitate her. Dr. Ashish is lucky today, handing over a lot of awards to lovely ladies here. Thank you, ma'am. And we would really like to thank all of you from the Khora Makhanpur Society for giving us this opportunity for being here. We would especially also like to thank few seniors of Foxy who are present with us. First of all, we would like to hand over a special appreciation award, Achievers Award to Dr. Yashodhara Pradeep ma'am, Vice President of Foxy. Hand over the Achievers Award to Dr. Alka Pandey, Vice President, Foxy. The final award for the evening, the person who is the youngest at heart, Dr. Ashish Mukhopadhyay sir, a fantastic singer, past Vice President Foxy, Chairperson of the Scientific Committee AICOG. Yes. Done a lot of research, who has led us in the field of research, and I still envy because I started off a little, I would say a little aged towards receiving awards in Foxy, but we saw sir receiving awards every year and that inspired us. Every year he'll be there in the validatory function getting a certificate in his hand, and we used to think, when will we become like sir? So this award is for Dr. J.B. Sharma sir. A special congratulations and appreciations to you, sir. He's a little upset, I think, because cocktails have not started yet, I guess. So इसलिए camera on नहीं हो रहा था. I'm noticing Ashish sir. So before we end again, special recommendations from the Khora Makhanpur OBGYN Society, Dr. Richa Singhal, for a special award today evening. Ma'am, please come up to the dais. Not the special appreciation from Khora Makhanpur Society. Ma'am, please come up. Please come up. Please come up. Please come up. Break this session for our singers, and before doing that, for all of us, we know Ojashwini quite well. I am sure all of you present over here also, she knows probably all terms of gynecology as of now. She's currently the CEO of Bloom IVF, and I would say backbone of Task Force Foxy right now. Congratulations, Ojaswini. Backbone of everything that sir does, yes.
The two backbones of the Yatra are Ojaswini and Priyankur. Please give them a big hand. Huh? Yeah, Priyankur.
For your years program.
Till I don't see everyone here, I'm going to keep saying this. Please come to the dais.
Dr. Seema Prakash.
As well with us now. She was in emergency and could join us now. We would like to felicitate ma'am with a boon, the last boon for the evening, but I'm sure it will help many women with boons in their lives. The successful evening that we just had.
Drinks and cocktail and dinner and dance. And I will request Gaurav to please come to the stage and put the party on dhoom. Kahan hai Gaurav?
So hey, one sound, just a sound check in the house. Yeah, done exactly. So hi, myself Gaurav Bhadwaj, I'm going to entertain the people. थोड़ा लेट हो गया I guess, but कहते हैं देर है दुरुस्त है I guess. मैं तो बहुत देर का आया हुआ हूँ. So check one, hey. Just I'm taking 2 minutes just for sound check. उसके बाद bang party start. जाने कहाँ कभी किसी को किसी से प्यार हो जाए क्या कहना है बाहर बन के आऊं कभी तुम्हारी दुनिया में गुजर न जाएगी कहीं everybody dance बाहर बन के आऊं कभी तुम्हारी दुनिया में गुजर न जाएगी कहीं इसी सपना में सुन रहे आज तुम कितना वादा करके जाना चुरा लिया किसने चुराया है That's right, lovely और गुलाबी दाल गुलाबी आंखें जो तेरी देखी शराबी ये दिल हो गया संभालो मुझको ओ मेरे यारो संभलना मुश्किल हो गया वो तो चकमा गुलाबी आंखें जो तेरी देखी शराबी ये दिल हो गया आई है तो छू के देखो ना कहाँ कहाँ That's right देखो सीने में कैसी हलचल मची है ओ साजना देखो सीने में कैसी हलचल मची है ओ साजना और बड़ा वादा करते हैं मेरे खिलाफ ठीक है वादा करो नहीं छोड़ोगे तुम मेरा साथ जहाँ तुम हो वहाँ मैं भी हूँ सुबह नहीं देखो जरा पीछे रखो जब तुम हो जब मैं भी हूँ सोचा है तुमने कि चलती जाए तारों के आगे नई दुनिया बस सोचा है ये कि तुम्हें रास्ता घुमाए सुनी जगह पे कहीं छेड़ करा अरे नारे नारे अरे नारे नारे कहना नहीं sing with me 1 2 कह दूं तुम्हें या चुप रहूं दिल में मेरी याद क्या जो बोलो तो जानो गुरु तुमको मानो चलो मेरे दीवाना है दो लफ्जों की है दिल की कहानी क्या है मोहब्बत या मुझे है सदमा दो लफ्जों की है दिल की कहानी क्या है मोहब्बत या है जवानी Have a huge round of applause for all the ladies and gentlemen in the house. Yeah, क्या बात है, क्या बात. Can we have some more retro in the house? Like this. करना कुछ नहीं है, जेब से सामान निकाल के बाहर करना है बस. अपने आप को free छोड़ना है हवा में. Come on, you people in the house. Here we go. 1 2 3 4. Here we go. आजकल दिल में प्यार की चर्चे हर ज़बान पर सबको मालूम है और सब लोग खबर हो गई तो क्या आजकल दिल में प्यार की चर्चे हर ज़बान पर सबको मालूम है can you hear the applause for each and every तालियां तो बता. That's right. Watch it, watch it. ये चांद का रोशन चेहरा, जुल्फों का रंग सुनहरा, ये दिल नीली आंखें, कोई रातों ये बगैरा ना. दीदी तुम क्या मुझसे आज भी ना भाई इधर ही आ जाओ आपका बोल रहा हूँ. दीदी तुम करूँ क्या मुझसे जिसने तुम्हें बनाया. That's right. सर जो गिरा टकराए या दिल डूबा जाए, आजा प्यारे पास हमारे काहे घबराए गाए. How are you? गिरा टकराए या दिल डूबा जाए, आजा प्यारे पास हमारे काहे घबराए गाए घबराए. अपना दिल जो आवारा न जाने किस पे आए. अपना दिल जो आवारा न जाने किस पे आएगा. है मुश्किल जीना यहाँ, जरा हटके जरा बचके ये गाजियाबाद मेरी जान है. मुश्किल जीना यहाँ, जरा हटके जरा बचके ये यूपी मेरी जान. हाल कैसा है जनाब का, क्या ख्याल है आपका. तुम तो मचल गए ओ यूं ही फिसल गए alright. अच्छा जिन्हें हारे चलो मान जाओ, देखिए अपनी यारी मेरा दिल जलाओ ना. अच्छा जिन्हें हारे चलो मान जाओ ना, देखिए अपनी यारी मेरा दिल जलाओ. अच्छा ठीक है. गजरा मोहब्बत वाला अखियों में ऐसा डाला, गजले ने ले ली मेरी जान. हाय मैं तेरे कुर्बान. अच्छा दुनिया है मेरे पीछे, लेकिन मैं तेरे पीछे अपना बना ले मेरी जान. हाय मैं तेरे कुर्बान. Come on everyone. छोड़ दो अच्छा ज़माना क्या कहेगा. ये रदा हो गया ज़माना भी है दीवाना, दीवाना क्या कहेगा. छोड़ दो अच्छा ज़माना क्या कहेगा. आंखों ही आंखों में इशारा हो गया, बैठे बैठे जीने का सहारा हो गया. आंखों ही आंखों में इशारा हो गया, बैठे बैठे जीने का सहारा हो गया. आंखों ही आंखों में बार बार देखो, हजार बार देखो, कि देख देख जीने में हमारा दिल रुका. ताली हो ताली के साथ, ताली हो जोड़ी ताली हो. ओ गोरे गोरे ओ काके छोरे, कभी तेरी गलियां आया करो. गोरे ओ काके छोरे, कभी मेरी गलियां आया करो. ओ गोरी गोरी ओ काके छोरी, चाहे रोज बुलाया करो. जरा नजरों से कह दो जी, निशाना चूक ना जाए. जरा नजरों से लड़ेगा. That's right. किसी न किसी से कभी न कभी, कहीं ना कहीं दिल लगाना पड़ेगा. सुनिएगा, कोशिश करूंगा आप सबकी रिक्वेस्ट इसके अंदर पूरी हो जाए. अच्छा कितने लोग यहाँ पे हैं जो भंगड़ा पा लेते हैं? कितने लोग हैं? नहीं नहीं. अच्छा अच्छा सुनो तो सही, मेरी बात तो सुनो, आप मेरी भी सुनो. अच्छा 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 अच्छा. Alright. बदन पे सितारे लपेटे हुए ओ जानी तमन्ना किधर जा रही हो जरा पास आओ तुझे ना जाए जरा पास आओ तुझे ना बदन पे सितारे लपेटे हुए ओ जानी तमन्ना किधर जा रही हो जरा पास आओ तुझे ना जाए जरा पास आओ तुझे ना जाए हमें जब ना होंगे तो किसे देख कर आए शर्माओगी न देखोगी फिर तुम कभी आईना हमारे बिना रोज घबराओगी बदन पे सितारे लपेटे हुए ओ जाने तमन्ना किधर जा रही हो जरा पास आओ तुझे ना जाए जरा पास आओ तुझे ना जाए लपेटे हुए ओ जाने तमन्ना किधर जा रही हो जरा पास आओ मुझे ना जाए जरा पास आओ मुझे ना जाए I am a disco dancer. I am a disco dancer. I am a disco dancer. जिंदगी का गाना मैं किसी का दीवाना तो नाच आओ मेरे साथ नाच I am a disco dancer. I am a disco dancer. ये पाँव मेरे को कभी भी रख गए थे जब लगाना नहीं था मस्ती है मेरी जवानी में रात मेरे लहू की रवानी यहाँ मेरी हार यहाँ मेरी जीत किसी का दो दिन की हस्ती में सदियों की मस्ती में दिन रात भागे जवानी दिल को मिलते हैं ऐसी जवानी में कैसे मिले आग पानी इस फूल में रंग मस्ती गिर जाए धरती की राहों में लगने को जुड़ जाए ओ जहाँ मिले प्यार वही मिले यार ओ जानी साथ चलो नाचो आओ मेरे साथ नाचो I am a disco dancer I am a disco dancer I am a disco dancer जिंदगी मेरा गाना मैं किसी का दीवाना
Well, thank you so much. Wow, Shukri, thank you so much. Saliyan तो थोड़ी देर से बजा देगा मेरा. Okay, so the next one is I call it a retro mashup. You can go through my YouTube also. उसमें मेरी वीडियो भी है सेम की. म्यूजिक मेरा है, गाने पुराने की मैंने एक mashup बनाया है. Just go through my YouTube channel, just write Gaurav Bhardwaj retro mashup. You find the same song. Subscribe कर दीजिएगा, अच्छा लगेगा तो. आइए सुनाता हूँ आपको एक retro mashup in the house, guys. Thumbs up, here we go. Thumbs up. All right, so 1, 2, 3. All the lovely people in the house. संभालो मुझको ओ मेरे यारो सुनना मुश्किल हो गया मैं भी हूँ गलियों की परछाई कभी यहाँ कभी वहाँ शाम से ही हो जाता है मेरा भी जादू जवान thank you so much. La 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 la. Thank you so much. ये मेरा दीवानापन है, या मोहब्बत का सुरूर। तुम ना पहचाने तो है ये तेरी नजरों का कसूर। ये मेरा दीवानापन है। बता मुझे दिल को तेरी तमन्ना, दिल को है तुझसे प्यार। दिल को तेरी तमन्ना, दिल को है तुझसे प्यार। चाहे तू आए ना आए, हम करेंगे इंतजार। मेरा दीवानापन है, या मोहब्बत का सुरूर। तुम ना पहचाने तो है ये तेरी नजरों का कसूर। ये मेरा दीवानापन है। The beautiful lines, all my favorite one. इसके बाद सुनो तो सही अच्छी लाइन है। 1 2 ऐसे वीराने में दिन घुट की मर जाएंगे हम। ऐसे वीराने में दिन घुट की मर जाएंगे हम। जितना जी चाहे पुकारो, नहीं आएंगे हम। ये मेरा दीवानापन है, या मोहब्बत का सुरूर। तुम ना पहचाने तो है ये तेरी नजरों का कसूर। ये मेरा दीवानापन है। Thank you so much. Thank you. तुमने पहली नजर जब नजर से मिलाई मजा आ गया। मेरे रश की कमर तूने पहली नजर जब नजर से मिलाई मजा आ गया। मेरे रश की कमर तूने पहली नजर, मेरे रश की कमर तूने पहली नजर जब नजर से मिलाई मजा आ गया। जब नजर से मिलाई मजा आ गया। बर्फ सी गिर गई, आग ही कर गई, आग ऐसी लगाई मजा आ गया। जब ही मुस्कुराई मजा आ गया। जवानी से टकरा गई, और जवानी जवानी से टकरा गई। आग की लड़ी मेरी आग से, आग की लड़ी मेरी आग से देख कर ये लड़ाई मजा आ गया। मेरे रख दिया तूने पहली नजर जब नजर से मिलाई मजा आ गया। क्या बात? Everyone, come on, people. पीछे वाले हो। Let's try this together, right? Let's make this one more memorable. Thumbs up, come on.
सहनी पड़ेगी सबकी कांटों भरी दी one more time sing with me ये जान तड़पम जी थामी है तेरी माई सहनी पड़ेगी सबकी कांटों भरी निगाहें सब सही कि हम और हंसेंगे हम आ मेरी जिंदगी ला 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 आई बड़ा सजना कालिम है दिल की लगी जाना ही बड़ा मसला कालिम है दिल बिन तेरे सनम मिटेंगे हम आ मेरी जिंदगी ओ जाना ही बड़ा सजना कालिम है दिल की लगी ओ जाना ही बड़ा सजना कालिम है दिल की लगी lovely all right can you huge round of applause for everyone guys and we miss you Ritti Didi तुझसे लोग कहेंगे ना कर प्यार मुझे, मैं तो लाख बुरा हूँ, नींद चुरा लूँ होश उड़ा दूँ, मैं तो बाहों में लेके रात सुला दूँ, बात सुना दूँ, जाने कहाँ दिल को छुपा आज उन आँखों के दो मुलाकातों के दो बचना है हसीन रोक में आ गया ये बचना है हसीनों लो में आ गया हुस्न का आशिक हुस्न का दुश्मन अब आता है यार से जुदा ये बचना है हसीनों लो में आ गया ये बचना है हसीनों लो में आ गया
Again, a huge round of applause for each and every guys. Thank you so much. Thank you.